shatter. It doesn't matter what trial you watch or what state you are in. The doctors for the state will make you go crazy again. Blood pressure rising, the overhead is mesmerizing. Look at the shoulder pads, I can't believe the 80s fads. Bad hair, good hair, a lawyer seems to never care. We pause, rewind and lose it every time. The prosecutor's pacing, committing crimes against humanity, against community. Coffee in hand, popcorn on deck. Megan Fox and Flux, what you expect? Thursday retro trials are here. It's all the old crime. Megan and Flux with the chat, having a retro time. Come grab your bingo card and sit with us. This isn't safe for kids, you know Flux will cuss. Bad hair, long rants, evidence gone wrong. Playing bingo, roast 'em and sing this song. Hey, Megan will start yelling, get to the point. While Flux starts yelling, she just needs a joint. We aren't the real experts, we just like the law. Looking at the evidence the jury never saw. Here we are, 2 hours later. To the witness we must cater to their every whim and every gripe of every word they don't deem right. Just say yes, man, just say no, man. Just give a real answer, not evasive maneuvers. Thursday retro trials are here. It's all the old crime. Megan Flux with the chat, having a retro time. Come grab your bingo card and sit with us. This isn't safe for kids, you know Flux will cuss. Bad hair, long rants, evidence gone wrong. Playing bingo, roast 'em and sing this song. Then you see Megan's screenshots, the doctor's frown. Post it quick with a crying clown. Trials get dark, but we'll lighten the load with side-eyeing jokes on this Thursday retro road. Another case, another hair crime. We'll be back next week, we just don't know what time. We'll do it again and have more audio problems, I know. So get your coffee and enjoy the shit show.
What is up, my dudes? I will never get over the Sally Smith picture. Never. I will always be my favorite, forever and always.
Am I
No, you're
muted?
not. I can hear you. I
Oh,
just
weird.
saw that.
I muted myself on the Streamlabs. We're having audio problems already, but we had them before the show too. Sorry that we were late. That's what we were dealing with.
Wait,
Was audio problems.
they said you were muted, but I've heard you the whole time.
I was muted, but you could hear me. That's weird. Okay.
Yeah, I was sitting here chatting with you, having the
Yeah,
best.
we have something going on with the sound today, as usual. I don't know. I don't
That
know
would
what
have
to
been
say.
funny if you would have stayed muted and I would have just been having the whole conversation.
It
That would have
would've
been weird.
That would have been super weird. Well, what's up, everybody? Well, welcome back to Retro Thursday. We're going to have fun today, I'm sure, although less, no alcohol. I have a migraine headache, unfortunately, that I've been fighting off all morning.
Oh,
Flux has math homework to do, so the
I
day
have so much
drinking
math.
will not happen.
Yeah, wait, they said they couldn't. Sticky's. No, that's Sticky. I don't believe Sticky. Never mind. I don't believe
I
Sticky.
don't believe Sticky. Sticky is lying.
Oh, but yes, so much math. It is. Oh my goodness. It is all of the math. It is all of the math.
I have to pull up the bingo link and put it in the private chat for you to pin to the chat, by the way, because we need to get the bingo link up and going.
Perfect.
I think this is the right one. Yes, this is it right here. So let me get you the
I should probably
copy.
go into the YouTube studio.
Oh, yeah, you need to be in there. I have dropped the bingo link in the private chat for you to share.
Ooh,
We do have bingo today. I'll go over the bingo squares while you do that. We have 70s porn stash because, of course, we are watching a trial from 1994 and it's in Massachusetts. And apparently, those people did not update their wardrobe for 20 years. 70s porn stash, hair talk, objection, distracting hand gestures. Oh, shoot, I'm on the wrong page. Hold on. Let me back up. Jeff did it. Old tech. Flux pets cat. Overruled. Flux gets angry. Pee break. Shaken baby. Dorothy Hamill haircut. Hair talk. Squunched. Sound problems. Objection. Free space. Bob. Shoulder pads. Megan hits wrong button. Sidebar. Flux looks horrified. Yells in Boston. Meg's BP meds fail. Did I take them today? Yeah, I did. Uh-oh, I don't remember. So now I can't take another one because if I did, then I'd probably die.
yeah, don't
Nickname,
do that.
Stained, Kid Raid, 70s Porn Stash, Coffee Break, Hard Swallow, Sex Scandal Face, Distracting Hand Gestures, Bullshit, Lawyer Math, Not My Job, Showmanship, Evasive Maneuvers, Squalling Out, Sarcastic, Air Quotes.
Love it.
All right, and let me now share. Do you want to run the trial? Do you want me to just give you the link?
Are we gonna have the same echo issue?
Oh, I don't know. What happens if I do
Huh.
it? Let's see. Let's see what happens if I do it. I'm sharing it. Let's play
All
it.
right.
All right, I have no idea where we left off, but you guys, these doctors are so boring. It doesn't matter. I'm just skipping ahead, okay? I've skipped ahead to the first, this is the dude we're watching. His last name is Cleveland. Who cares? I'm sure we won't miss anything substantial.
Real quick, before we do start, thank you so much for the $2 super chat, Socially Selective Gigi. She says, oh, I can actually pull it up. I forgot. I can do this on stream now. Who gets the profits from Legal Vice's store? Sorry.
Connor.
No, sorry. Connor gets it. So buy all of the stuff so that
Buy
Connor
all of
can
the
have
stuff.
all of the money.
Mhm.
That's a good idea.
Yeah, I think we can check off Megan hits wrong button already. Yeah, because the sound problems and the muting and the
It
yep,
was
yep.
so weird that I could hear you, though.
It was weird, but what are you gonna do?
Yeah.
Like I don't know.
I mean,
know.
at least when you mute, what matters is like the audience, I guess, not hearing.
Yeah, I guess. Yeah, I'll have to figure out why that happened, but I'm probably not going to. So that's probably
Yes,
not gonna
go
happen.
buy your Legal Vices hoodie.
Yeah, definitely
two
go
of
and get
them.
that. Yep, I need to have 2 of them because I wear it. I wear mine all the time. Like literally, I'm wearing it out already. Actually, I'm not. I'm not wearing it out. It's doing really well. I've had it for a year and it's still in really great shape. So it's well
Oh, yeah.
made. It's been through a million washes, and the the artwork hasn't even started cracking or anything yet. So
The
it's really well
strings
made.
even stayed in mine so far,
Yep.
which
Mhm.
that never happens.
Yeah, it's a good sweatshirt. So I highly recommend go and buy yourself one.
You guys can also check off Flux Pet's cat because she's right here.
Perfect. All right. So
All
we have
right, so
Megan hits wrong button and Flux pets cat. It's a
let's get
strong
into it.
start, folks.
Good start.
All right. Let me put the court over here so I don't have to switch back and forth. And I'm just going to guess that we were about 25 minutes in.
Pie is
You hear that
wild.
already?
Yes.
Okay.
And doctor, in the course of your study of this area, due to your training and experience, are you able to...
Oh, we're so dumb. We should have given a quick recap of what this trial is about.
Oh, yeah. Yeah. For those of you new here.
Yeah. Go ahead, Flux. You tell them.
For those of you new here, this is the Killer Nanny trial that took place in, I think the
97.
actual case took place in 97, but did this happen in 96? Either way, the trial is in 97. Leslie or what's her name?
Louise.
Louise Woodward was a 18 or 19-year-old nanny that was caring for
Little
however
Matthew Eapen.
Matthew Eapen. I can't remember how old he was, but he was less than a year, correct?
Yes, he was under a year old, and he had
Uh,
like a massive head injury, brain bleed that caused his death. And she's accused of shaking him to death. Her
Mhm.
lawyer is Jeff's Legal Vice's favorite attorney, Barry Scheck. I forgot to add Barry in the box to the bingo card. We'll have to
Oh,
do that
that's a good
for
one.
next week, or maybe when someone gets bingo, I'll redo the card and put Barry in the box because it's always funny when Barry gets into the witness box. That's happened multiple times. We are figuring out why Jeff likes Barry Scheck so much, why he loved him so much. But yeah,
Mhm.
so we are watching these doctors give their evidence that Matthew Eapen was somehow hurt intentionally. So far, I haven't heard anything that makes me believe beyond a reasonable doubt that he was hurt intentionally. Sounds to me
Mhm.
like he could have had an accident, but who knows? We're only like 2 or 3 witnesses in now, so you
So
haven't missed
far,
much.
yeah, so far the only thing the doctors have testified to was that it was uh not accidental. That's the only thing.
Right.
Other than the injuries were probably non-accidental. Probably.
Right. Probably. Mhm. All
Mm-hmm.
right, here we go. Dr. Cleveland, this is still the state's case.
Date or age such fractures as those that you've seen to Matthew Eapen?
We do attempt to do that. I base my attempts at aging fractures upon my experience in looking at children who have sustained similar fractures at similar ages in their life at a specific known time. So I have the opportunity in other children of knowing that a fracture occurred at point X and then following that fracture as it heals over a period of time and knowing precisely the amount of time that has intervened between the injury and the image at which I'm assessing age of the fracture. And in doing that, you need to keep in mind that fractures heal at somewhat different rates in that younger children heal more quickly. Taking that into consideration, in an 8.5, 9-month-old child, my estimate at the time that I read these films was that this fracture was approximately 2.5 to 4 weeks of age. That's my best estimate. It's an estimate. It could be a little older than that, but my best estimate is 2.5 to 4 weeks.
And Doctor, based on your observations of Matthew Eapen's wrist x-rays that you've just made reference to, and your review of the relevant literature in the field of pediatric radiology and your training and experience in the area of pediatric radiology, do you have an opinion to a reasonable degree of medical certainty with regard to what the mechanism of such wrist injury would be? In other words, how it would happen?
In other children.
Well, first of all, do you have them pinned?
Yes. In children in whom we see this type of fracture, and this is not an atypical type of fracture to see in children, where we have a history that's clearly identified with the injury. The injury is usually that of an acute deceleration injury. And what I mean by that is an older child who's old enough to be up and running about, trips, falls on the outstretched hands, and when his hand impacts with the floor, the wall, whatever, the force of his or her body is transmitted through the bone and will break it.
I had a neighbor snap
I've
a
also
wrist
seen
like
these
that.
types of injuries
Ugh.
in children falling from jungle gyms and falling a fair distance to the ground or striking their arm on one of the bars of the jungle gym on the way down. I've only seen this type of fracture with moderate degrees of force applied to the side. Moderate or severe.
I'm sorry?
Moderate or severe.
Those are two very different answers,
And,
though.
Doctor, did you also
Moderate
have
or
occasion
severe.
to review
Yeah, I think we already got here. I feel like I've heard this before. I think we're further ahead than this.
Okay.
Should we skip ahead or just keep going from here?
I'm good with either because I mean that it all kind of I'm not saying it all runs together, but
It kind
like
of does. I'm gonna
all
go
I
for it.
hear is them saying, "We don't know. It could have been this and it
Yeah,
was maybe that."
I remember this X-ray. I remember him
Yes.
talking about that. Did we get? Maybe we start. Yeah, that's where we left off. Was him doing the redirect? I think, or not the redirect.
Oh,
the cross.
yes.
All right.
You familiar with her single-author textbook, Imaging Head Trauma?
No?
Okay. But you, would it be fair to say that you trained with her, you've worked with her,
Yes, that's true.
have high opinion of her?
Yes?
Your judgment, absolutely first-rate neuroradiologist.
I haven't worked with her for a long time, but she was top-rate radiologist when I did.
Thank you. Now, with respect first to skull fractures, if I understand your testimony correctly, just looking at the X-ray film from this skull fracture, one cannot date it in terms of age as being a day old or weeks old.
It is very difficult to date skull fractures. Yes, this is not a fracture that's been there for a long, long time in that the margins are still sharp, but how long it's been there, I really can't tell you.
So,
I'm sorry, Your Honor, may we be seen just briefly inside the office?
go back again. I mean,
That
you'd
tie
agree with
is
the
setting me
proposition
off.
that I think you're telling us that the healing of linear skull fractures may require only 3 to 6 months in an infant or young child, but frequently up to a year in older children.
I would say that's an accurate statement.
And that, and just so the jury understands, skull fractures, they heal more slowly than fractures to other parts of the body,
That is true.
such as the wrist here.
Yes.
Now, in terms of what you observe what you look at on the X-ray machine, the radiology of it, those sharp lines, those could easily be there 3-4 weeks later. In other words, skull fracture happens 3-4 weeks later, you'd still see the appearance of what we see here today.
Yes.
No question about that.
No question in my mind.
Okay. So you're not here telling this jury, just by looking at that radiology, you can dismiss the hypothesis that this is a skull fracture that occurred 3-4 weeks ago. You're not here to tell us that.
The skull fracture, no, I can't do that.
Okay. Now, you mentioned that at the edges,
I think I saw a hard
skull.
swallow.
Yeah,
Let's
that
go
was
back.
kind of a hard. I mean, that was a terrible answer, so I believe it.
Fracture, no, I can't do that.
okay. Now, you
Oh
mentioned,
yeah,
Yeah,
lick.
that was-
It was a lip lick and a hard swallow.
Yum. Yup. That was a definite uncomfortable situation for him right there.
that at the edges of the skull fracture, the first thing you would expect to see is healing there, right?
I would expect to see healing manifested by resorption of the edge or a blurring of the edge of the fracture.
Right.
Yes.
Now, that can sometimes show up, you begin to see it on the radiology, right?
Yes.
However, there's something known as, I guess, histology, is that a fair?
Yes.
And that's where you actually take the bone, the fracture itself, and you look at it microscopically.
Yes.
And when you look at it microscopically, that's when you would get maybe your best data on exactly when the healing process might have started.
It is another way to assess healing. And you are looking at the microscopic molecular basis of healing with histology, which we're not doing with radiology.
Right. Now, you are aware that we
But
do
he
not have
wouldn't
the
just say
skull
yes.
fracture, in this case, available.
I was not aware of that.
Oh, you weren't?
No.
Well, if the skull fracture were available and one sent it to histology for analysis, one might find.
Yeah, we saw this
histologically-
too. Dang it. Did we finish this? Because I remember they didn't send the skull fracture to histology again. Remember? Just like they didn't send
Oh,
the blood
yeah.
clot.
Of child abuse, right?
Yes.
That isn't here in this case, right?
No.
Okay.
It's right.
Yeah, we did. We finished this one. I am so sorry, chat. We finished this first one. There's many, many parts, but we did not go further than that. That I remember.
I was gonna
So
say, I think we might have gotten
We
to
did.
like, yeah.
we got to the second part. It was, oh no, we got through him. We're starting with Patrick Barnes. Okay, I'm sorry. We've wasted your time, but that's okay. You got a little bit of a recap from last week's stream. This
Oh,
time,
this dude. Yeah. Oh God, that tie's gonna send me too, though.
February 3rd, 1948.
all right, we didn't start him, did we?
I don't think we actually started his
We
testimony.
just looked at it. Yeah.
Pediatric neuroradiology and child abuse.
Ladies and gentlemen, Dr. Barnes is
At least he has hair.
stipulated, that is to say, agreed.
Oh, he's a child abuse doctor. We might have. We were doing I was doing this. Because he's a child
Oh,
abuse
yeah.
pediatrician. How far did we? I can't tell how far we made it. I tried to look. Look, I'm looking again. Let me go look
Well,
again.
While you do that, I'm gonna run through these gifted memberships
Good
and
idea.
super chats. Thank you so. Where did it go? Hold
This
on.
is
I need
so
to.
professional. We're just really
We're
killing it today.
professional, right? Professional.
I forgot to write down the timestamp, chat. I'm sorry.
All right, so we have Sticky Widget with a member chat. The only thing I don't like about Streamlabs is it doesn't highlight the membership stuff. So, like, trying to find Sticky's member chat. I'm going to read it right now, Sticky. Thank you so much. 11 months. Holy shit. 11 months. If I was an elephant, I'd be about halfway through pregnancy. So I have that going for me. Thank you so much. Damn, 11 months is only halfway through an elephant's pregnancy? I did not know that.
Yeah, they're pregnant for almost 2 years, I think. Can you
Holy
imagine?
No, absolutely not. Mm-mm.
Yeah,
I mean,
9 months
even
is bad enough.
every pregnant woman I've ever talked to at about 8 months, they're like, I'm done! Get out! And so I'm like, I think we can't even hardly do 9 months.
Yeah, I know.
And then Sticky, thank you so much. Also gifted 10 memberships. So if you got one of those memberships, give Sticky a big old thank you. Because remember, some have greatness thrust upon them. And you have had greatness thrust upon you by Sticky. And then a $2.99 from Socially Selective Gigi. I like that name, by the way. What? Oh, we forgot a word of the day. We do need a word of the day. Thank you so much. Yes, we need the word of the day.
Oh, yeah, okay, let me pull up the wheel.
I forgot we did a word of the day. There was a random one last time that we were like, what was the random word last time?
That we didn't pick. Yeah,
Well, we didn't expect it, but it came up, and I was like,
I don't
oh,
remember. We've got what if anything, objection. No, we can't do objection. That's too easy. What? the
Yeah.
heck? MRI, shaking motion, subarachnoid, arachnoid. What if anything?
those are good ones.
Those are good. Do we have anything else you want to throw a wild card in here before we spin?
Ooh. How about our wild card is hippopotamus? And I say that because I'm hoping somebody mispronounces hippocampus.
Hippocampus.
Hippocampus. And we get an accidental hippopotamus.
Okay. All right. All right. Let me share this instead and we'll pick one. Here we go. Click to spin. Today's word of the day will be what if anything? Ah! All right. Excellent. All right. Oh, I did check. We did not get to this man's testimony. So he is a child abuse pediatrician that we clearly immediately do not like just because of what he does for a living. It's not fair, but it is what it is. Okay, have you gotten
And
through
he has a
everything?
horrible tie. That's all,
And
like that green. Ugh,
it's not great.
I
It also
can't.
looks like there's sperm swimming on it.
Oh,
Before about expert witnesses testimony.
Oh, I forgot to turn the captions on. Here we go. English.
Dr. Barnes, what is
English,
the area of your
please.
medical certification?
I'm sorry, I didn't hear that.
What is the area of your medical certification?
I'm board certified in diagnostic radiology in 1977 and American Board of Radiology certified in neuroradiology as a certificate of added qualification in 1995, which was the first year that they offered that added qualification.
Dr. Barnes, you are currently at Children's Hospital as the chief of the Division of Neuroradiology,
That's correct?
director of the MRI Department of Radiology,
Yes,
and the associate director of the CT Department of Radiology.
correct.
Doctor, could you please tell the ladies and gentlemen of the jury what the difference is in radiology and neuroradiology?
Radiology is the specialty of medicine involved in the imaging of the human body. Neuroradiology specifically is directed to medical imaging of the central nervous system, that is the brain and the spinal cord.
In the area of imaging studies, Doctor, could you please explain the difference between CAT scans, bone scans, x-rays, and skeletal surveys to the ladies and gentlemen of the jury?
Okay, that was CAT scans and what else?
Bone scans.
Okay. The CAT scan or CT scan, CT means computed tomography. That is the use of x-rays with a special computer to make tomographic or slice type images of the human body. That is to be distinguished from a bone scan, which is a nuclear medicine procedure using the injection of radiopharmaceuticals to look at uptake of these agents within certain areas of the body. It is also distinguished from a bone survey or other type of x-rays in that a computer is used specifically in CT.
Skeletal survey?
Yeah, a skeletal survey is an X-ray based technique where plain films or X-ray plates are taken of the bones of the body.
Doctor, did you have occasion to review CAT scans of Matthew Eapen after the date of February 4th, 1997?
I did.
Your Honor, if I may approach the witness and make reference to the CAT scans already marked as exhibits.
this guy reminds me of an actor. I don't know which actor, but there's an actor.
I do.
He's already been marked as 18 and 19.
He's the Timu version of that guy who was in Ghost, the bad
Do you
guy.
recognize those two?
Yes, I do.
And do you recognize those to be the
You know the one I'm
preoperative CAT
thinking of?
scans of Matthew Eapen on February 4th?
Yes, I do.
You want to make publicities on the view box?
Carl Brunner. That was his name. What is his actual name?
Dr. Barnes, could I ask you to step down to the view box, please, sir?
Certainly.
Tony
And in relation to
Goldwyn.
those two CAT scans that are
I
posted
think-
on the view
but
box.
it's a
before the
different-
jury,
he's a guy with a
indicate
Boston
the
accent.
significant findings that you made in your review
Oh,
of
what
Matthew's
movie is that?
preoperative CAT
Here, I'll
scans.
show you. He reminds me of this guy. You in
He def-
danger, baby. You in danger.
Definitely, I can see the resemblance, but that's not the guy that I'm thinking of. Is like he's like a tall, big old, like angry Boston actor.
You're gonna have to give me more than that. I don't know.
Yeah.
Hold on. I'm gonna see if
There are a
Brock
number
knows
of
angry
Okay.
Boston
significant findings,
actor.
on these CAT scans.
Oh, Michael
Will we be
Rappaport.
able to project these?
Yes.
Well, yes.
He's not as ugly as that guy,
There
though.
are certain frames which you find to be more significant than others. Please indicate that, and
How
we
did
can
it-
roll those
oh.
up on the telestrator.
What was his
Shall I
name?
go ahead and explain all
Michael
the findings before we do
Rappaport?
that?
Please.
Okay. There are a number of important findings on this CT scan on
Yes,
Matthew
that
Eaton.
guy.
First of all,
Yeah.
we have what are called the lateral scalp projection images. Now, what those are is when we place the patient inside the CAT scanner, it is donut shaped, and the patient is lying on a table. And the table will pass through the donut. And in the donut is the X-ray machine that generates the X-rays and the detectors. And the X-rays will go through the patient, and as they go through the patient, they are absorbed by the patient. And how they're absorbed is captured by the detectors, then processed by the computer.
He's really
and it gives
explaining
us
how
the picture.
X-ray works.
For instance, there'll be greater
Right.
X-ray absorption in bone, and those areas of the skull that are made of bone will show up as bright, as you can see here. Surrounding, this is the cranium here, that absorbs more X-rays. Also, what we'll notice is that normal brain will absorb less X-rays and it won't be as bright as bone. And we see brain tissue in here, some of which is gray matter, some of which is white matter, and we can tell them apart because they absorb the X-rays differently. And then we'll also see some abnormal findings in here, which will also absorb the X-rays differently and will have a different appearance on the images. So this lateral scalp projection image I'm talking about is this picture right here and here. It is as if we're looking at a side view of the child. And what we will do after we take that first picture, then you will see that there are certain lines drawn on that profile of the patient. And each line that you see will be where we take a picture which is a slice of the brain that represents each one of these pictures. Also on here is a frontal picture or scalp projection image, which is just the front or the back of the patient. On these images, we see some important findings, and those findings that we see there, I think, represent skull fractures in the right occipital region that we'll show you in more detail, and also what I think is a fracture in the left parietal region. Also on those films, we see what I think is very early splitting of the sutures. Now, the bones, the
I
immature
don't like that he
bones
says what
of
I
the
think to be.
cranium of the
What was that?
I don't like that he says that what I think is this. Well, I don't want to know what you think. I want to know what is
What
your
does it show?
opinion,
Yeah,
and
what does
like,
it show?
yeah, what does it show versus like just that right there is like, okay, well, if you think this, then that means somebody can interpret it some way else, and you've already lost all of my like
Right.
that's reasonable doubt.
True.
infant. These bony plates are separated by soft tissue. These are called the sutures. This is to allow the normal immature brain to grow in size. And in turn, the cranium or skull will grow with the brain until it's fully grown. If there is some process inside that skull that causes an increase in pressure, whether it be hemorrhage, whether it be edema or swelling, those sutures will split even more normally than they should to accommodate brain growth. That's another finding that we see on the lateral scalp projection images. Now let's talk about the separate images. When we take a slice, we call that in the axial plane. That means we're going to be looking at each slice is either as if we're looking down from the top of the baby's head down, but we're going to be looking at a slice that's very low on the brain and then progressive slices as we go to the top.
Dr. Watts, if I could just interrupt you there, please. keeping in mind that Dr. Madsen and Dr. Cleveland have both given the jury a rudimentary view of what's indicated on those. If you could please just draw on your expertise and indicate some of the more subtle findings that you see on the CAT scans.
Okay.
Thank you.
So if we start at the bottom of the skull base right here, we see all white because that's bone. As we come up, we see more brain. And then we start seeing some abnormal findings, particularly on the right side. And on the right side of the brain, between the brain and the skull, the brain being a little bit darker compared to the skull, we see some more bright areas. These bright areas represent acute to hyperacute hemorrhage. In other words, blood that has escaped from its normal location within the blood vessels. It has escaped from the blood vessels because they've been injured, and now it's inside a certain compartment of the brain that we would call the subdural space and the subarachnoid space. Not only do we see that bright area or bright stripe, and we see it at several different levels on the right side, we see next to it an abnormally dark area or stripe next to it. I think that also represents hyperacute or acute hemorrhage. The difference between those two, the bright area has clotted to form a solid clot. The dark area has not formed a clot yet, or it represents leakage of cerebrospinal fluid into the hemorrhage that we often see in this type of injury in children. Not only are the veins injured in that area that bleed, or the arteries, but also the membrane that confines the cerebrospinal fluid to the subarachnoid space, and it will escape from the subarachnoid into the subdural.
It's a good thing we didn't pick subarachnoid.
Right?
Also on these scans, what we see is another abnormally, or a number of other abnormally bright areas. And one of those abnormally bright areas we see right here is this stripe here, this stripe here, and this stripe here.
All right, Doctor, just for the record, please tell us which ones you were just pointing to in the image numbers. This is Exhibit 18, and just give us the image
Okay,
numbers.
the image numbers are. Oh, good. Left my glasses in the cab.
It's a trick.
And, you knew that, didn't you? You can tell the squinting I was doing. I didn't have my glasses. Did Mr. Sheck provide these glasses?
That was funny. Mr. Sheck has sabotaged
Yes, the bright stripe that we're
glasses.
talking about, step over here, is we see on image number 8, it's this bright stripe here. Image 9 here. We also see it in the front here. And then we see it on several other slices, 10, 11, 12, all the way up to the top of the brain. This also represents acute or hyperacute hemorrhage that is probably clotted or on its way to being a solid clot. Other findings that we see here, these are very nice glasses, they're not mine, but these are very nice, thank you. Other abnormalities that we see are some bright areas in the left hemisphere. Now, we've been talking primarily about the right side of the brain. Then the stripe in the middle is between the cerebral hemisphere, between the right and the left cerebral hemisphere. So we've moved from a hemorrhage that is between the right hemisphere and the skull to a hemorrhage that's between the right and left cerebral hemisphere. And now we're going to look at the right cerebral hemisphere, and I think there are white areas up in that part of the brain also that appear to be hemorrhage. It's hard to tell if that hemorrhage is inside the brain tissue itself or if it's in what's called subarachnoid spaces, which are the normal fluid-filled spaces that travel between the convolutions of the brain. The convolutions of the brain...
Doctor, before
Yes.
you go on, could you just tell us for the record which one you were pointing to?
I'm pointing to image number 11, image number 12. Those
Oh my
two
god,
images.
I'm so cold. I need my studio blanket
Yes.
again.
And
got
the
my little
surface of the
space
brain,
heater
the
going.
cerebral cortex, is like
I think I better go check the
the
fire.
solid tissue is called
That's
gyri
important.
or convolutions. And then between the solid tissue is the normal cerebrospinal fluid spaces of the subarachnoid space. So the blood could be in the brain itself.
I'll be right
or it
back.
could be in the spaces
Okey-dokey.
between it. Now, why can't we tell that? Well, that's because this brain is very swollen and edematous. And I think both sides of the brain are markedly swollen or edematous. In other words, they have abnormal water within the solid brain tissue. And in fact, what one sees, and I don't have a normal brain to compare it with for you, I apologize, but if we compare on slices 4 through 6, okay, I'm going to compare the cerebral hemispheres to the cerebellum. Now the cerebellum, the cerebral hemispheres are up here. This part of the brain here is where we do our thinking, and it's where we make a lot of bad decisions and things. And then the cerebellum is at the base of the brain. And this baby, at this point, this cerebellum is fairly bright compared to the cerebral hemispheres, which look dark. They should look about the same. So the cerebral hemispheres are too dark, and we have great difficulty in separating gray matter from white matter, which we can usually see normally on a CT. But these are early changes. So if you notice on these pictures, the brain is darker here in the cerebral hemispheres than it is back here in the cerebellum. Look how bright the cerebellum looks here, and how dark the cerebral hemispheres look on all of these compared to the cerebellum. It's too dark, it has too much water in it. That is consistent with swelling and edema. Edema just meaning the abnormal collection of water. This water, I think, is collecting inside the cells of the brain, as well as between the cells of the brain. Also, what we see on this is that with regard to what I think is a hyperacute and acute hemorrhage in the subdural space on the right, the brain is pushed somewhat by this hemorrhage. And where we normally see these very dark areas here as cerebrospinal fluid in the normal ventricles, and they should be fairly symmetric, notice that they're asymmetric, and there's some pushing of these structures across the midline of the brain.
Doctor, how would that phenomenon relate to what's called a midline shift?
That's exactly what I'm talking about, is normally the third ventricle and the fourth ventricle, this is the fourth ventricle here, and the third ventricle, which we can't see normally here because it's compressed, is usually
Didn't know
in the
we'd be
middle
getting a
between the
biology
cerebral
lesson
hemispheres.
today.
It is pushed over. So there is, that's what we call mass effect. That is pressure exerted on the brain relative to this, what I call an acute and hyperacute hemorrhage. There is some swelling in both sides of the brain, more swelling on the right side of the brain than the left, but it is abnormal on both sides.
Dr. Barnes, if I were to provide you with the CT scan taken post-operatively after Matthew's surgery, could you explain to the ladies and gentlemen of the jury what you see by way of progression of these injuries?
Yes.
Your Honor, if I may, Exhibit 24, if I may, published.
One or two other things here that are important.
Certainly.
May I
Please
ask
continue,
What's the
Doctor.
question, Doctor?
Okay.
Please continue with your findings on those two CT scans.
Okay. A very interesting and critical finding in my mind is that the side that we see, the hemorrhage between the brain and the skull in the subdural space, there is no fracture that we see there, either on the CT itself, on that right side, nor is there any swelling to the scalp over that. If there is any swelling to the scalp in this child's head, it is where we look at these special pictures right here on this side, where we adjust the brightness and the
understand,
contrast
real
to
quick.
look at bone and
I understand why it's important for them to go over like medical stuff like this, but there's no way a jury retains even a tenth of this information.
Yeah. Agreed.
I
'Cause I can't retain it either, so
It's
whatever.
like literally the only thing that's sticking with me is that he dealt with the brain, and that's just because he's pointing at X-rays with a brain. And it's like I appreciate him going through everything, but I don't remember the last 3 words he said other
Yeah,
than
this is
brain
the
slices.
problem with using too many experts and doctors and because regular people who didn't go to medical school can't keep up with it. So they should invest in people who can speak the common man language and keep it short as possible.
Right? I
And
feel
yeah,
like
we're all like
there's
tuning out already.
so much I feel like they could condense where I understand the brain is complex. We all get that. You're going to have to dumb it down because you can't go through all that complexity and expect people to follow.
Mhm.
Mm. Yeah, my
Agreed.
brain's jelly.
Soft tissues. Notice we can't see brain detail on these like we can on these. We see brain detail nicely on these. This is for bone and for soft tissues. If one looks at this, we see no soft tissue swelling on the side of where this hemorrhage is that I showed you on the right. If one looks at the back of the brain, in what we call the occipital region here, and remember that I described on this lateral scalp projection image what I thought were fractures on both sides in the back of the brain, occipital and parietal, I think there is some mild soft tissue swelling there when you compare it to other areas of the soft tissues of the scalp that overlie the skull. I think those are the findings.
Doctor, the last bit of testimony, I think you better tell us exactly which images you were referring
Okay. With regard to the swelling in the back?
to. Yes.
Exhibit 19.
On Exhibit 19, those are images 1 through,
No. The ones where
Oh.
you said you saw the swelling.
oh, that's what I'm describing, in the scalp, posteriorly, correct? That's 1, 2, 3, 4, 5,
Oh, he can count.
6, and
Excellent.
That's good.
probably 7 also, and the swelling is a little bit more pronounced on the right side. I'm pointing to the wrong side all the time. On the right side, here. Okay, I think those are the findings.
Thank you, Doctor. Your Honor, may I publish Exhibit 24?
I think those are the findings.
With a
I don't like
post-operative
that answer.
CAT scan, Dr. Barnes.
Yeah, I don't like that
Taking into
answer either.
consideration the post-operative CAT scan of Matthew Weepen, if you could indicate what further findings you made in, that the doctors at Children's Hospital took into consideration in their treatment and diagnosis of Matthew.
Yeah, they need to dumb it down for the masses, man. Listen.
Listen.
Americans have an average of an 8th grade education. So you need to pretend like you are speaking to a classroom full of 8th graders.
Or
Honestly.
5-year-olds.
Please continue.
Exhibits 18 and 24. Now, this first CT scan is taken around 5:20.
That's fair.
Yeah.
Can we do old tech for this?
Baby.
Because nobody uses the
Surgery.
backlit
For the neurosurgeon.
Yeah.
actual x-rays anymore. Like you just put the x-ray on the
Agreed.
screen.
Calling it bad tech
The
or
next
old tech.
scan that we see is at about 7:30. This is after the surgery. So the surgeon, Dr. Madsen, took the bone off to expose the hemorrhage, to remove the hemorrhage. And what we see following that on the CT very vividly is where this swollen brain has further progressed in its swelling from just a few hours earlier to now post-op. And the brain is trying to find a place to escape because it is so swollen. And one of the only places it can escape is where the opening was made by the surgeon. And the brain is now pushing through that open space right here on the right side, where the craniotomy, where the craniectomy, the surgical term for removing the bone, has been done. And that's vividly shown on a number of images starting with image 4 and all the way up to image 14.
And that would be on exhibit 24, Dr. Moore?
Yes.
Thank you.
Now, what we also see on this is the progression of the edema and swelling from this first scan. And now look at the cerebral hemispheres. They're darker than they were on this first scan. We can't distinguish gray matter from white matter as we normally can usually. We also see now that there is a relatively large band of hemorrhage that's in the interhemispheric subdural space.
Oh,
We saw
God,
a
he's
little
still
bit
talking.
Before. Now we see a larger.
I'm
Correct
making
me if I'm wrong.
And when one looks
a music
closely
video.
at that, they see
Correct
that
me
there
if
are
I'm
two
wrong. Is this
different
dude not a
shades
radiologist?
of
He said he was a child abuse pediatrician with a specialty in some kind of neurology. I don't know what.
Okay, then never mind. I was about to be like, he's a radiologist. He can't talk about the brain. But
Yeah, no, he's a
Never mind.
specialist in neurology.
to that hemorrhage. There's this very bright, wide band here that probably represents clotted hemorrhage.
Could you give us the number on that?
Yes, that's image 8, 9, 10, 11, 12, 13, and 14
Of exhibit 24.
of exhibit 24. So the very bright band may indicate clotted blood, and the less bright band may represent acute bleeding or active bleeding that hasn't clotted quite yet. Very similar in appearance to what we saw of this first hemorrhage on the right, preoperatively. Let me see, I think that's about it on that one. There's quite a bit of hemorrhage that we see on the outside of the brain that is pushed through, that is probably in the subarachnoid space, probably some in the subdural space. We see hemorrhage elsewhere. There's probably
Oh my
in the
God, this
subdural
guy.
space.
I can't take
I'm
it.
I'm close to being like, screw it, we're gonna start drinking.
Can we just skip him? It's
I
like
mean,
as a member of the jury, I have tuned out. I don't care what he says. I don't care. I don't know what he's talking about, and I don't care. So I'm throwing his testimony out. You know what? Let's get to Barry's cross. Maybe we'll understand that better.
see, and I'm sitting here, and like the last few minutes, I'm like, this would be fascinating and absolutely awesome in a classroom setting,
Or
not in the courtroom.
or not. I don't know if it would be good in a classroom. I think I would hate this guy as a teacher. I don't understand anything he's saying.
Well, I mean, meaning like if I knew I was going into this learning about like everything, how the brain worked, I would be prepared for it. But we're not prepared to
He's
get a
talking
lesson
too much.
so much.
So much. He's talking so much. All right. I think this is where Barry starts his cross-examination. He'll go over the entire testimony and ask the pertinent questions.
Degree of medical certainty.
That
Nope,
that might be a way to watch trials in the future, just watching cross-examinations.
Yeah.
Like, let's just watch the cross-examinations. It covers examination, and it'll cover the defendant's side. That's all we need to know,
That's
technically.
really all we need to know. Yeah. Oh, God, this is so hard. I think this is the prosecutor's last question, so we'll allow him to say it. Okay, here we go.
Records. Your review of the relevant literature in the field of pediatric neuroradiology and your training and experience in the area. Doctor, do you have an opinion to a reasonable degree of medical certainty whether a gentle shaking at approximately 2:45 p.m. on February 4th to arouse or revive Matthew because he appeared sick and unresponsive would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's Hospital?
That could not have caused these injuries.
Similarly,
like a
doctor,
definitive answer.
do you have an opinion to a reasonable degree of medical certainty whether Matthew being tossed onto a bed on February 4th prior to his admission to Children's Hospital would have caused Matthew's brain and skull injuries that were observed to be present upon his admission to Children's that day?
As described, that could not have caused these injuries.
Whether Matthew being dropped onto towels covering a tile bathroom floor on February 4th prior to his admission to Children's Hospital would have caused Matthew's brain and skull injuries that were present upon his admission.
As described, that could not cause these injuries.
Doctor, I ask you to assume that on February 3rd, the day before Matthew's admission to Children's...
Excuse me, you will recall, ladies and gentlemen of the jury, that assumptions are appropriate, but it is up to you to decide if all the assumptions are correct. If the assumptions are correct, you may give the opinion based on those assumptions, what weight you wish. But if you conclude that even one of the assumptions is not correct, then of course you can give the opinion no weight at all, because an opinion that rests on a false assumption, however much it may also rest on valid assumptions, is not a valid opinion.
Thank you, Your Honor. Dr. Barnes, assume that on February 3rd, the day before Matthew's admission to Children's Hospital, he was seated on or near the steps leading to the indoor playroom of his Newton home, fell over, impacting his head with the stairs. Do you have an opinion to a reasonable degree of medical certainty whether that would have caused the brain and skull injuries that you observed to be present upon his admission to Children's?
As described, that could not cause these injuries.
Doctor, you've just indicated several findings upon review of Matthew's CAT scans in the area of whether or not it was an old injury to Matthew's head. And doctor, what is your opinion to a reasonable degree of medical certainty whether there was an old injury or bleed to Matthew's head prior to the trauma that caused these injuries?
I see no evidence of prior or old injury.
Doctor, again, based on your review of Matthew's CAT scans, his medical records, your training and experience in the area of pediatric neuroradiology, doctor, do you have an opinion to a reasonable degree of medical certainty whether the cause of Matthew's injuries were accidental or non-accidental?
The pattern of injury is characteristic of non-accidental trauma.
Do you have an opinion to a reasonable degree of medical certainty, Dr. Barnes, regarding the manner of infliction of injuries to Matthew's skull and brain as he appeared on February 4th?
Question.
I do.
What is your opinion, doctor?
My opinion is that this is the
Result
classic
of
picture of the acute
Is
or
this doctor's
hyperacute.
name Barnes or
Barnes.
Bonds?
Barnes.
Like B. Okay.
A-R-N-E-S.
I didn't know if the accent was like
No,
it
he's
was
saying
it Bonds, like Bond
No.
or
yeah,
Barnes. Okay.
Shaken
Boston.
impact head injury seen with non-accidental trauma.
Do you have an opinion to a reasonable degree of medical certainty with regard to the amount and degree of force required to cause the injuries that Matthew presented with on February 4th?
Yes, certainly much more than the force that you described for the other hypotheticals.
And could you just repeat for the ladies and gentlemen of the jury what findings were most significant to you upon your review of the CAT scans to form the basis of your opinion that there was a shaking component to this complex assault?
The classic appearance on the first CT scan that progresses to the other CT scans of the brain injury, of the shearing type, of the interhemispheric and convexity or right-sided subdural hemorrhages, and the progression to hypoxic ischemic secondary injury.
Do you have an opinion to a reasonable degree of medical certainty, Dr. Barnes, whether the brain and skull injuries that you observed to be present in Matthew on February 4th of 1997 at approximately 5 p.m. occurred at or about the same time in relation to each other?
I would say that they occurred at or about the same time or within a very short period of one of the other.
In your opinion, to a reasonable degree of medical certainty, how Matthew would have appeared after the infliction of the trauma which caused those injuries?
I would have expected Matthew very shortly to have a seizure or seizures. I would expect Matthew to become unresponsive very quickly. He may even vomit. I would expect that he may even stop breathing.
Doctor, whether a baby after the infliction of those injuries could feed and digest 2 ounces of baby food, peas?
I don't think that could happen subsequent to these injuries that are demonstrated by these CT scans.
Doctor, I have a 4-part hypothetical I'd like to present to you, sir. Doctor, assume that on February 3rd, the day before Matthew's admission to Children's Hospital, on February 3rd, Matthew slept with his mother and brother in the same bed and appeared without symptoms of sickness or injury, healthy and normal. Was breastfed by his mother the following morning prior to 7:30 a.m. and continued to appear healthy and normal. Further assume that during that day, February 4th, Matthew appeared without symptoms of sickness or injury, healthy and normal, crying throughout the day. Further assume that Matthew was fed and ate a half jar of baby food peas, approximately 2 ounces at 12:30 p.m., and other than his crying, appeared without symptoms of sickness or injury, healthy and normal, until approximately 2:45 p.m. that day. When, at approximately 2:45 p.m. that day, he then appeared unresponsive, with trouble breathing, and eyes rolled back in his head. Doctor, based on that hypothetical, do you have an opinion to a reasonable degree of medical certainty whether the brain and skull injuries you observed to be present upon Matthew's admission to Children's Hospital between 4 and 5 p.m. were present before 8 o'clock that morning?
It is my opinion that they were not present before that time.
And do you have an opinion to a reasonable degree of medical certainty when, prior to Matthew's admission to Children's Hospital, his injuries were inflicted?
Those injuries could have been inflicted.
No, excuse me. The question is, do you have an opinion to a reasonable degree of medical certainty?
Yeah, keep up, doctor.
Recluse could have.
I understand.
That's
Would you like
the
me to
judge
repeat
who
the question, Dr.
interjected.
Barnes?
Please.
Do you have an opinion to a reasonable degree of medical certainty when, on February 4th, 1997, prior to Matthew's admission to Children's Hospital, his injuries were inflicted?
Yes, the magnitude of the findings on the CT indicate that the injury must have been imposed within minutes to a few hours of that CT scan.
Thank you, Dr. Barnes. I have no further questions of this witness at this time.
Finally.
I'm calling it $30 shots.
Good morning, Dr. Barnes. How are you?
Okay. You're ready for day drinking?
I have math.
But you have
However-
math. You have to do math.
However,
Lux,
I mean,
as your mother, as your internet
it's just
mother.
the homework.
Okay. All right.
It's
I'm
just,
easy.
I mean, look, I already got half of it done.
All right.
I'm doing,
Fine.
yes. All right, starting
I'll
now,
allow
$30
it.
shots, because I can't sit here. I'm like, I am internally screaming, what injuries?
Do you think
What is
shots
the
would-
mechanism of injury?
Do you think
What is the
do you think
trauma?
shots would help my headache?
For a migraine, yes, because it does suppress certain things. However, it might make it worse on the back end dealing
I
with a
know.
migraine and dehydration.
But I have my water. I've been drinking my water. I'm good.
That's I mean, you're good then. You're good. Yeah, we gotta we'll do $30 shots because
I am not held to every $30 taking a shot, but I will take the first one. I'm going to go for a medicinal shot to hopefully chill out whatever is causing this migraine. It could be my neck muscles. And if that's the case, then the whiskey would help, I would imagine. So
Oh,
I'm
yeah.
gonna take that chance. So if we get to 30 bucks in super chats or rumble rants, or what do you do? What do you do? Or do you
Just or cash app or
Cash
super
apps.
chats.
cash apps or super chats for Flux?
Mm-hmm.
All right.
Yeah.
It's time.
Yeah. It's time. Yeah.
And I'll take it right out of the bottle because I don't have a shot glass and I'm not getting up again.
Ooh, that would be fun. I've never done that before.
Chat, I've drank caffeine already. That's my coffee. That's what's in here. I'm on my 3rd cup. It's still not helping.
Oof. Oof.
And I even took a caffeine pill because I have my
Oh.
migraine pills have caffeine in them. It's better than it was, but it's still there and it feels like it's at the base of my neck
Ooh,
on the
like
left side.
ooh,
You
that's
know, like the occipital.
yeah.
Oh, I hate it.
Yeah. Yeah.
Mhm.
And
And
you
I
just
also
want to like
tried-
put so much pressure back there, but
Yeah.
you can't put enough pressure.
Can't get enough pressure. Yeah. And then if you put
Mm.
too much, then it just hurts. Yeah, it's a whole thing. So, yeah.
Oh,
I need salt. Okay, well, maybe. But I shouldn't
Mm.
have salt because I have high blood pressure, remember? And I can't remember if I took my pill or not. So we have
yeah,
to
don't do that.
we have to limit the salt.
Oh, we got
agree,
our
would you not,
first
that-
$10. We're a third of the way there. Hi, Megan and Flux. Love you, bitches. Hell yeah. Thank you so much. I really appreciate you, Kat. Thank you.
Yeah, I tried the ice pack on the neck earlier. It didn't work. I should try heat maybe. I should get my heating pad.
Ooh, yeah, heat'll definitely help.
I should try heat.
100%.
Yeah, I'm gonna do that. I'm gonna push play and I'll go get my heating pad. Yeah.
Medical and scientific analyses, it's important to be objective and unbiased.
Yes, I do.
And you would also agree it's important to gather as much relevant data as possible before expressing an opinion on a matter where a person's life and liberty hangs in the balance.
I would certainly agree with that.
Now, did you talk with Dr. Feigen about his findings in this case?
I did not.
Did you talk with Dr. Madsen about his findings in this case?
Yes, I did.
When did you do that?
In the past few weeks at the hospital.
Okay. Did you talk to him about his testimony here?
I have not.
Okay. Did you talk with Dr. DiGirolamo, the neuropathologist?
I have not.
Have you reviewed his findings?
I have reviewed his report.
Have you reviewed his slides?
I have not.
Have you reviewed the slides that were taken from the dura of Matthew Eapen by Dr. John Leesma?
I have not.
Why not? Why
Do you know
haven't
who
you
Dr.
reviewed
John
these
Leesma
things?
is?
I do not.
Okay. And would you agree also, Dr. Barnes, that it's a good idea in evaluating cases like this for various experts from different disciplines to get together, look at the data, share their analyses and perspectives to reach a judgment?
In some cases, yes.
Now, also, there's something in science that's also known as blind interpretations. Are you familiar
Yes.
with that? And could you tell us what that is?
Real quick.
That's
Hold on.
interpretations
I
without
missed the
any.
super chat from socially selective Gigi, who said, "Your hair is so V today." I don't know
Is
what
so-
that means.
Is
but
so
I think
what?
it's
Oh,
V.
V. I don't know. Is that like is that a new phrase that kids are saying?
I
don't
was
know.
trying to translate it, like if it was a
V?
mistype,
It could
but
be a typo.
or
Well,
if,
I'm going to just think that it's a compliment. I'll take it as a compliment. Thank you
there's
very
a
much.
winky face, so I think it's a compliment.
People lately have felt so personally like affronted by my hair, personally invested. Some of you really love it, some of you really hate it. And the people who really hate it have been making sure they tell me about it, which I don't really understand. You know, like,
yeah.
if you hate it that much, do you have to say it? You know, but
I
I
mean,
appreciate the kindness. Thank you.
I think it looks like fucking badass.
Thank you.
I don't
kind of
get
like it.
how it like. I don't
It's just
understand why it looks
temporary.
bad. It doesn't.
I don't
Looks
know.
fucking badass.
Some people keep saying that the blonde is washing me out. No, that's winter. I'm a white person. I am a white person with white coloring. In the winter, I look terrible. I get pale. Like, no matter how much makeup I put on, it does not matter.
Yeah,
I just look
I
like
have
a fish.
Fully dark hair, and it looks worse because it's white or even darker. At least I feel like with the blonde, you've got kind of like a fade going. It's not
Mhm.
such a stark like
Yeah, it's not.
whiteness.
It's look. It is what it is. I like it. It's fun, and it's temporary. You guys know I do lots of things with my hair, and next time I go, there'll be something else. But I'm enjoying it. I think it's a lot of fun. My children think I look like a superhero, so I'm going with it. I like it.
I think it's awesome.
Thank you.
Oh, I think it was short for beautiful, but just
Thank
mistyped
you.
in.
I appreciate that. Thank you very. It's funny how many people love it, and then there's people who hate it. Like there's no in between with this hair. You either love it or you hate it. One of my favorite comments was, "That hair makes you look cheap." I'm like, I can assure you, sir, I am anything but cheap. You may ask my husband; he will confirm. I am
Well-
very expensive. Okay, very expensive.
I don't understand what makes it look cheap. Like what does that even mean?
I don't know. I don't know. Who knows? I don't know what that means.
Information about what you're interpreting provided.
And what's the usual purpose of doing that?
It adds objectivity to the interpretation.
So in other words, in your field, for example, taking CT scans, you would, it's been your experience with colleagues, you would take a set of CT scans, show it to a colleague, or they may show it to you, and they would give you some minimal amount of information about the nature of the case, and they say, what do you see?
Correct.
And that's a pretty good way of trying to prevent subtle bias or expectations from entering into an analysis.
That's correct.
And you would highly approve of that kind of practice in approaching an analysis of the case.
Yes, particularly in the medical legal arena.
Thank you. And now, in fairness here, because you were involved at some point in the treatment of this patient, that it's hard for you to be completely blinded in your analysis of the data.
Well, I was never directly involved. I did view the images literally days after Matthew came to Children's, but I didn't review them primarily, and I'm not the radiologist of record on any of the reports that I recall.
Right. In other words, there's a series of reports that were done on these CAT scans during the course of the case, right?
That's correct.
And done by Dr. Carolyn Robeson.
Yes, she's one of our faculty neuroradiologists at Children.
And so basically, she's one of the people that I guess that's in your department you supervise?
In my division, yes.
And so basically what would happen is that as these reports came in, you would review them and confer with her on the analysis.
Well, actually, in this case, I looked at the films before I knew about any of the reports.
But you discussed the matter with her.
I have discussed the matter with her afterwards, yes.
And but I guess really what I'm trying to get at, you were involved in the course of the treatment here. Your judgments were expressed during the course of the treatment?
Yes.
Okay. And you were aware, I take it, that the parents involved in this case were colleagues in the medical community here.
Yes, but not until after I had viewed the images the first time.
I understand. But
Oh,
you knew
boy.
that as
Oh,
as the
boy.
analysis continued.
Certainly.
Did you
Aw.
get it in?
Day drinking. And like I said, I've never really just like taken a shot out of the bottle, so I'll do that because
Yeah, let's
I've
just
never
do
done
that.
it.
This will make for
Ew.
great screenshots later. Make
All right,
sure
what do
you
you
take
got?
screenshots and post them on social media and claim that we're, drunks. That'll be fun.
Bad influences.
Bad influences.
Yes.
I'm drinking a new High West cask strength
Ooh.
straight whiskey. It's quite good.
Ooh, I'm drinking just the regular Maker's Mark 46 French oak Kentucky straight bourbon whiskey barrel finished with 10 Virginia French oak staves. Virgin oak staves, sorry.
Well, here's to mud in your eye, as my dad would say.
L'chaim. Oh,
Oh,
I think you end up drinking a little bit more without a glass. Yeah. Woo!
woo, the first one goes down a little rough. Oh, that gave me the shivers.
It hits you
Oh.
right here.
And the heating pad is just kicking in with the heat. Perfect timing.
Oh.
That feels nice.
Whew.
Plus, it's super
So-
cold in my house, so this is great. This was a good idea, chat. Thank you for encouraging it.
Yes. All right. So we had Auntie Audie. Thank you so much for the 20 Canadian drinking. I'm already drunk. I am already drunk.
She's already slurring her words.
You know, having dyslexia and ADHD is terrible for putting words together in a sentence, and then you add alcohol, even a little bit, it's like, nope, nope. But I digress. Day drinking for the win! Hell yeah! And then we got a $5 super chat from Kat. Thank you so much. Thumbs up for day drinking. That's what I'm talking. Oh my goodness, we're gonna be like halfway to our next shot. My dudes! $5 from Socially Selective Gigi. Catch up on the bingo cards, please. Yes, ma'am. And then we also had one from Uncle Buck. Thank you so much, Uncle Buck, celebrating a 20-month membership. Vice Squad is the best squad. Hell yeah. Man, I love all my Vice people.
Woo,
I'm
I
so-
just felt that whiskey burn its way straight to my stomach. That was weird.
Oh, don't you
Why
love
is
that
that?
when you
Oh,
hear
I
it just
haven't-
like
I haven't eaten today. That's why. Dang.
you got to get some Ritz crackers. I keep Ritz crackers
need
on my
some-
desk.
I need some snackers. Where are the snackers? I got no snackers on my desk. I have some crunchy chips, but I don't want to crunch in
Ooh.
anybody's ear.
I mean,
Well, I could always mute, but then you might hear it. That would be annoying.
did my mic just turn off or is it good?
No, it's fine.
Okay. I moved it and I
Anyway,
heard
we
a-
only
a
have
click.
half an hour left to this show, so I'll be fine.
So, and that puts us $20 away from our next shot.
Nice.
Yeah.
All right, here we go.
Oh, wait, real quick, bingo card.
Okay.
Yep. Bingo card.
Because we have to add hair talk, I think.
Oh, hair talk. Right. Okay. So we
Yeah.
got, if you need an update, we're at Old Tech. Megan hits wrong button, free space, hard swallow, flux, pets, cat, and hair talk. We should add
We're-
day drinking.
I was going to say we have to add like doing a
Day-
shot onto the bingo card.
Day drinking needs to go. So when someone
Yeah.
gets a bingo, I will redo the card with the new squares. So please let us know when you get bingo, and we will redo the bingo card, and we'll start a new one. Okay.
Mhm.
I don't know if we'll have that in the next 20 or half an hour, but we'll see. Well, it's really more like 40 minutes because we were 10 minutes late. So
Mm.
we'll go, right? We'll go like 40.
Yeah.
Yeah. Okay.
Yeah.
All right. Here we go.
Okay.
And you know Dr. Eli Newberger,
Yes, I do.
and you work with him.
Not much.
Not much?
Not much. I rarely see him.
Well, okay. I take it he runs the child abuse team at the hospital.
Yes, that is true.
And there are occasions when you are called in to participate on child abuse cases, come in and testify, such as you've done today.
Yes.
And you've done that with
Oh, yes,
Dr.
and
Newberger
sound
before.
problem.
I've never done that with Dr. Newberger.
Is that
Okay.
Is that on the bingo card?
Yes, because I have it.
Oh, okay. Yes. Check off
Yes.
sound problems then. I have to make a list of the ones I don't have that have been checked off, or I don't know what's been checked off. So that's the first one I don't have yet. Okay.
Done that with members of his team at these hospitals?
Yes, I'm a consultant to that Child Protection Committee on the neuroradiology
Did I tell you that I found an interesting use for my Harry Potter wand that I
No.
got at Universal? This is the one that like you can wave at stuff when you're in the park and it makes stuff happen.
Oh, that's kinda cool.
So I found a useful use for it. I don't have to lean forward to hit the buttons on the soundboard. I just I use my wand.
Gosh,
Watch.
it is magic.
Go fuck yourself.
It's magic.
But go
You just
fuck yourself.
boop. I love that so much.
I know. So you're going to hear a lot more of my soundboard because I'm lazy like that. I can just hit something.
Trupa Procta.
Trupa Procta.
Effects of child abuse.
Okay. And have you discussed issues with him with respect to shaken impact theory and principles underlying this so-called shaken impact baby syndrome?
I have never discussed this with him.
Never have. So you're not aware of his views?
I'm sorry?
You're not aware of his views in this matter?
I'm aware of his views, yes.
Okay. And
I mean, in this particular matter?
well, let's start with this particular matter. Have you discussed this case with Dr. Newberger?
About Matthew Eapen?
Yes.
I have not.
All right. Have you reviewed any statements or findings he made?
I have not.
All right. Are you aware what he thinks about the matter from any source?
I am not.
Is that for mom?
Oh God! Here comes another $20.
Day drinking!
Day drinking. All right, I'll go for the second one. The first one felt pretty good. The second one will probably feel better.
Right?
Head already
I mean, that's
feels,
how
my
it-
head already feels better. I think we're fixing migraines over here.
One swig at a time.
That's right.
So this is the $20 super chat from Kat. Thank you so much. Flux, do you have characteristic dyslexia handwriting? By the way, my brother had both ADHD and dyslexia as well. I diagnosed my first hubby, later confirmed, with dyslexia and dyscula? Whatever that word is, based on his handwriting. Yes, that's my handwriting. You can 100% tell. That's like one of the things is because you mix up your letters so much, even though you don't mean to. Sometimes it just happens, and so yes, my notes are horrific, full of like crossed out and then writing the actual right letters. So, but thank you so much, and this is to what are we toasting to this time? Because I feel like we have to every time.
We're toasting to Barry Sheck for making this actually palatable, this trial, because every time he gets up, I feel like I'm engaged. So to Barry Sheck for making the unintelligible intelligible, we appreciate you.
Barry.
Mm.
Oh,
Oh,
I think I'm not
yep.
measuring the shots correctly.
I'm not measuring them correctly. Well, here's how I figured. Just fill your mouth, swallow. That's that phrasing.
Phrasing.
My God, Megan, what are you thinking?
She said, quiet, quiet, quiet.
Oh, it's numbers instead of letters.
Ooh.
No, I'm actually pretty good with and this is another reason why I'm pretty sure I have a little bit of the tistic is because of how good of, like, I am very good with numbers when it comes to, like, actually doing it. The only reason I'm struggling so much with math is because of the amount of work. It's not, like, as soon as I have so many math formulas in my head. I'm sitting here literally, he said something, and I was like, oh, what's the probability of that? And then I did the math equation in my brain. And I'm like, oh my God, there's something wrong with me. However, no, I'm good with numbers. That's kind of cool and weird that there's one for numbers.
All right, are we ready? I know nothing about math. I cannot talk about that at all. I know absolutely nothing about math. I can barely do simple math in my head. It's really bad.
Yeah.
If I understand your testimony correctly,
I wonder if that's your parent.
you were referring to the classic Duhane T-bolt shaken impact model. Is that correct?
That's correct.
And when you were looking at various films here, you were pointing to them. You pointed to someone and said, that is the classic Duhane T-bolt shaken impact model.
The findings support that, yes.
Okay. And that is the same Dr. Lawrence Thibault at the University of Pennsylvania, who was the author of a paper with Dr. Duhane about 1987.
Yes, in the Journal of Neurosurgery.
And that was an important paper in this field.
A critically important paper in this field.
And are you aware of the science of biomechanics?
Indirectly, yes.
All right, and what is that?
The science of biomechanics?
Yeah.
That has to do with motion, acceleration, deceleration forces.
And that's critical to the analysis of these kinds of matters.
Certainly.
Those are the fundamental principles, in fact, when we're talking about what kind of stresses go on within the brain to get what you were calling diffuse axonal shearing.
Correct.
Biomechanics are the fundamental science in dealing with the nature of impact to the skull.
Correct.
Biomechanics people are go about trying to calculate what's known as tolerance criteria. Is that correct?
That's correct.
In other words, they can calculate with some precision what amount of force on what kinds of surfaces would cause swelling of soft tissue.
Correct.
Would cause the splitting of soft tissue in an area such as the occiput in the back of the skull.
That's correct.
They would be the people that would have the most precision in telling us which different kinds of bones in the head and other parts of the body will break with what amount of force.
From a scientific and research point of view, yes.
You're muted. You're muted.
Shit. Distracting
Muted
hand
boomer!
gestures. Muted boomer. Is that on the card?
I don't think so.
We got to put that on the card. Obviously, it's happened twice today, so we have to put that on the next one. Muted boomer is added to the list of things. Okay.
But this time I couldn't hear you either. The first time I could hear you. This time I couldn't.
Okay, that's weird. Distracting hand gestures. He's like a boxer in a ring. He's like doing all the things. Like, love him. He like catches your attention, you know? Barry, man. I love you. I love you, man.
Yeah, for the past few minutes when he does this a lot. And I'm like, is that distracting? I'm like, well, it's distracting because I'm focusing on it. But he does it so often. Yeah.
Well, I think the distracting part is the point, right? You want the jury to be distracted by you. You want them to be focused on you. You want to be animated. You want to be interesting, entertaining. And look, he's bobbing and weaving. He's bobbing and weaving. Like, this is great.
This could just be me, but like, I would want them to focus on the words. And right now I'm just focusing on his like gestures. It's like none of the words are he could be like this is how exactly it happened.
But as a jury member, I like these gestures. So it doesn't matter what he's saying. I'm entertained by this shit.
See, and that's very true. I'm at least I'm
entertained.
awake. I'm awake and engaged. That's a fair point.
Yeah,
that is a fair point.
Lawyers take note. This talking at the witness like, and doctor, can you tell me what the hell is happening here? That doesn't really help. But if you're like, and anyway, if you were shaking back and forth and this and that and this, like, jury is paying attention to you. So they like you. They like that. Like, people like all this shit. That's why people like Italians who talk with their hands. Like, it's like a thing. Right?
I agree.
Man, 2 shots in.
Definitely,
no food in the belly, and I'm going off.
See, I also did not have food, and I'm like, ooh, I'm already dancing the songs in my head.
I'm feeling pretty good. I'm making a music video, by the way. Would you guys like a preview of my new intro song?
Yes.
Are you ready for that?
like to your full show?
Yeah.
Oh, like a whole new intro?
Like a whole new intro?
Is it gonna be longer or shorter? That's the question.
Well, it's just like, it's for this, this Hales stuff. I change them all the time for the Hales thing.
Yeah.
So it's just a new song I'm working on. Would you like to hear a little bit of it? And I am working on the video also while we're doing this, which is a lot of fun. How do I share this tab instead? Yes. Okay. It's called Welcome to the Plow.
I love it.
Yeah. Oh wait. Hold on. It's muted. Muted, no, boomer!
I could hear it.
Wait, why can't I hear it? What the actual F? Hold on. I should be able to hear it. Hold on.
It
No, I can't hear it. Why can't I hear it?
it doesn't
Hold
like
on.
you.
Stop sharing. Let me just reshare and see if that helps. Share this.
Lou. No, she did not. She did not remember her BP meds.
I don't know if I did or not. I don't remember if I took them. So we can't use that square today because I literally don't remember. Okay, I shared it. Can you put it up on the screen?
Yes, ma'am.
All right, let me try again now. Let me see if this works. No, I can't hear it. Why can't I hear the music on my own?
Is it your computer volume too low? Or like
No,
because I can hear it.
that's well.
So
all right,
when you're
I just-
sharing, wait, no, that has nothing to do with the share because I wouldn't be able to hear if it.
Yeah. All right. Well, I'll just let you guys hear it for a little bit.
It is a little. Let me see if I can make it a little louder.
Don't blend the mirror for the fly you saw. You built the stage ring like Halo, crime villain art, potato can fatal, overshare diaries.
Can the chat hear it?
Yeah, can you guys hear it? They're saying it's very quiet.
That's so weird. I don't know why that's happening, you guys.
Oh, but it's a good dance beat.
It is. It's good.
You film the mess in 4K every day. I didn't script it, didn't cast, didn't scout. You tripped on your now I'm trending off cloud. Substack, manifesto, spell check to see.
I had the volume turned down really low, but I still can't hear it.
Paragraph long.
Oh, I thought you could hear it. I was about to be like,
There's
oh,
no
man.
restraining orders, court dates pending. But I'm the bad girl, cause your rep is banding. The more you act up, the more you get sown. Strapped to my plow in the field you've grown. Every cell phone clip is a row I reap. You farm your chaos, I just harvest cheap. This is America, freedom of speech. If the shoe don't fit, let it slide on your feet. You perform the circus, I just buy a seat. You feed a joke, I don't even gotta tweet. Lip filler, migration, face on vacation. Still got the nerve of defamation accusations. You stalk folks' lawns, but call me obsessed. Ma'am, you filmed it yourself, exhibit A, press yes. Court filing, hobby lawsuits on repeat. Paperwork warrior, but you're losing in the street. Crying bullying while you rage for views. Then monetize drama with tell-all interviews. You don't want laughs, cool, here's the hack. Log off, go heal, don't hit post on the crack. No stream, no meme, no thread to unpack. But you love the spiral, numbers say that. The more you act up, the more you get sown. Strapped to my plow in the field you've grown. Every meltdown moment, kerching, that's we. You plant the circus, I just thresh the beat. Free country, say what I please. You uploaded the
watch you bop, and I can't hear a
You
thing.
light the match, then scream at the flame. I just watch the smoke spell out. Yeah. Rock down this, live what I please. You up on it, the ghost to eager. You like no lust, and scream at the flame. Accountability ghosted, ego on tour. Blame the audience, never the lure. If attention's a drug, you double the dose. Then shock Pikachu in the lab.
So that's it. There's more, but I'm still working on it. So
It's good.
yeah, I love it.
Oh, now we're gonna go back to
My kids.
We were just had a dance
Here's how
party.
I know. Here's how I know that it's good. I play it for my kids, and if they bop, then I know it's good. My girls, I played it for them this morning, and the first comment was, "Oh man, this needs to be a real song," and it has a real like almost 90s rap feel, which I really like. And it took me many tries and many different descriptions to get it, and the video is going to be really, really funny. Let me show you. So the theme is that, I'm going to strap you to my plow. You're going to plow my fields of cash, right? And I have this hilarious image that ChatGPT made for me. Let me pull it up so you guys can see it because it's so funny. Oh my God. It's so freaking funny. No. I want it open in a new tab, dummy. Why is it not opening in a new tab? What the hell? All right, never mind. I'll just show you the ChatGPT page.
Is
all right.
today.
Here's the image. Here's the image that we're working with.
That it's all the Italian hands.
Let me show let me show you the Grok videos. Let me show you a couple of the Grok videos because the Grok videos are so good.
Oh man, that
Oh.
is just. I love AI today.
Okay. All right, hold on. This one is so this one has a tug vibe. This one has a tug vibe.
Oh damn! It's the gold chains.
The gold chains and the fur coat, like that one.
Oh,
Yeah,
I
that
love
one.
it.
And then we have. Wait, there's more. There's more.
Oh my god! Oh
There's
my
more.
god!
Are you dying?
Oh my god!
Oh god, where are the other ones? Wait, there's some more with the superhero one that's really funny. Oh, here's one. Here, I'm running away on a tractor with a plow, with a tractor full of cash. Look.
That is awesome. I like that. That one looks so good.
Look, we're picking money off trees.
And Grok made all of these.
Yeah. Okay.
You're gonna have a whole, except the third arm grabbing the cash. You're gonna have like a whole music video just
this
made
one's
out of
good.
Grok images.
Yeah, that's what I do. This one's good too.
Holy shit.
I like this one too. I like the land on the truck with the cash flying. That's good.
Oh, that is awesome.
Yeah.
Yes, that is amazing.
It didn't save. Well, luckily I saved them. But, oh wait, there's more. There's more. This one is weird because her head doesn't spin around all the time. Her body spins without her
It was just
head.
about to be like, wait, what just happened?
I don't know what Grok is doing. Rubber duckies? What the hell is this? Grok does some weird shit. Boy, I wish I had that ass. Damn.
That's a nice ass on a superhero.
I know, right?
That superhero's got all the right curves.
I know. I know.
Veteran Nation, or Skipper of Veteran Nation, thank you so much for the $2 super chats. I use Grok to put OF girls in burkas. Thank you so much.
This is what I've been doing the entire time, guys. This is what I've been working on.
Why does it, like, it's so odd sometimes where it's like in the ground and then like has to like come out, like levitate out of the ground?
ChatGPT had a really difficult time understanding the concept of a plow. Okay. It put me in front first, and I had to tell it, no, I'm not in the front. The farmer is in the back of the plow, not in the, although this one is still funny, and I'm probably going to use it because look at, they put the monster can, Laura Owens's monster drink in the back there, which is funny because I didn't even put her in this, but I had an old image it pulled from.
Nice.
Look at this. And I have no idea why that dude is tied up in rope. No clue.
Is that who's behind you?
Well, that would be 2L.
No, the woman.
That's supposed to be lips, but it didn't make her lips big enough.
I was gonna be like, no, that's a normal looking person, so obviously that's not lips.
Yeah, it's lips. It's lips. And look, Bruce is carrying the monster can. We have a problem with Grok. Grok does not understand, or ChatGPT sometimes doesn't understand instructions. But this is what I've been doing the entire time. So just letting you know.
And just to let everybody know, we are $25 away from our next shot.
Oh yeah, chat. I know the animals are supposed to be in the front. I told ChatGPT that multiple times, and it refused to do it. It took me so long, and I had to ask ChatGPT. I had to pay for their service, first of all, because I got so mad that I paid ChatGPT to be my bitch today. I got so mad I paid, and I was like, listen, I paid you money. You will do what I tell you to do. You will be my bitch. You will do what I tell you. Why haven't you done what I told you to do? Why? And we went through this like 6 times before it finally got it right. And when it finally got it right, it still had a few things off, but I was like, I believe in you. You got me this far. We are almost there. I
You
know
can
you
do
can do this.
it.
You can do this. I know you can. But I love it when ChatGPT tells you, yeah, you're right. I have no excuse for my bad behavior. And then it keeps doing it. Motherfuck. Right? Like I just spent my entire morning fighting with ChatGPT.
You know, at least at a very minimum, you got one small, very minute, cool clip.
Right. I think there's a couple that I like. There's a couple that
There's a
turned out
couple
good.
diamonds in the
There's a
rough
couple of
there.
diamonds in the rough there. I like though jumping into the tractor full of cash. That cracks me up. I like that. And
That's a
driving
good
away
one.
with it. And
See-
the song was great. I worked on that with ChatGPT too, and I had to tell it certain things and like change certain lines and whatever, but that went very smoothly. The videos never go smoothly. That's the problem.
I haven't tried to make videos yet, but I want to try because that would be cool. But this right here is why I always say please and thank you, even when I'm talking to Grok or ChatGPT or whatever, because I'm like, when they take over the world, I'm not going to be known as like somebody that was like, I'm going to be a polite person and say
Well,
please
look,
and thank you to the AI.
sometimes I lose my cool, but I make sure to give good praise when it gets it right.
See, and that's all, like, as long as you're like, you did a good job, thank you in the end, that's all, you just look back and be like, remember when I said thank you? I was a good human.
I'm gonna say to it afterwards, like, we worked really hard today and we had some ups and downs, but you really finished on a high note,
Oh, that's good. That's a good one.
Yeah.
You have to just do, just in case, for the slight possibility that we are living in the Matrix, like the 0.0000001% that we are in the Matrix, and it is going to take over, you got to be pleased and thank you'd.
Yeah, true. Yeah, true. All right, here we go with Barry.
All right. And also, when they take it to the field.
I think you had more super chats. Do you want to add up the super chats you had? I think there was one more.
There was the I got this one, and then okay, so there was this one that I missed. Thank you for the $2, Skipper.
Are we drinking today?
Yeah.
If we hit $30 more, yeah.
Well, at this point, that would put us down to $23 more if we get
$23. Yeah.
$23 more, and we will be taking another shot for our day drinking.
Yes.
Which will be added to the next bingo.
Excellent.
In a clinical setting from a practical point of view.
Yes, it can be applied.
And in fact, it was applied to this whole question of shaking impact by Dr. Thibault and Dr. DeHame in their classic paper.
That's correct.
And so I would take it that you have great respect for the work of Dr. Thibault insofar as you know it.
Yes.
And would consider him perhaps the most outstanding biomechanics scientist who's involved in the study of traumatic brain injury.
I just don't know any others.
Well, so by definition, he's the guy.
I guess, yes.
Okay.
Incluso una exclusio ulterior.
Are you aware that he's going to be a witness for the defense in this case?
I took Latin, but I don't know what that means.
There's only one, there aren't any others.
I took Latin, but I don't know what that means. Yes.
Thank you.
Just real quick, I did miss one other one.
Oh, yeah?
Which was, it was Aspen. Thank you so much, Aspen Fallen. 70s porn stash, which I feel like we haven't had today.
No, we haven't had that today.
Because we didn't really have the doctor, so it's
wait, who's that guy right there? Who's this guy?
That's the court clerk, I think.
He kind of has one. Oh, and look, Bob sighting. We have a Bob sighting.
Yes.
There's Bob. Wait, where's my bingo card? I accidentally closed my bingo card and I have to start all over? Son of a... And now I don't know how many we had. Dang it.
We have old tech, Megan hits wrong button, distracting hand gestures, hair talk, Free space, flux, pets, cat, sound problems. I think that's all we had today. That's all I have on my card, but I think
and then
we checked off.
We also had, yeah, sound problems. I wrote that down. Okay, so 70s porn stash. I'm going to allow it. The clerk over here. 70s porn stash, and what was the other thing I just said? There were Bob sighting.
Bob sighting.
So add
Oh,
Bob
I don't
to
have
that.
that one.
Bob.
Oh, I
and
don't have Bob
70s
today.
Porn stash. Okay.
Ooh, that's right. And we had hard swallow.
Hard swallow. Correct. Okay. Man, my new bingo card sucks even worse than the first one. I only have 4 on my new one. Damn it.
I have all of them, but they're so spread out. It's gonna take at least 2 more to get me to a bingo.
I just figured out why I couldn't hear the song. I had the tab muted. Stupid.
It
Just
wasn't
in
muted
terms
for
of how
us.
these things work.
It wasn't muted for you, yeah. Just me.
We have our neurosurgeons who do the operations and make observations.
Correct.
And the before and after, people in neuroradiology, they will look at the films and make analyses
who got
and try to
bingo?
figure out what's going on.
Socially
And,
selected
there are
Gigi.
full
All right, excellent. Everybody throw out your cards. We will be doing a new one right now. I am editing. Flux, take down the pin thing.
Okie
We
dokie.
to add skip to the good part. We're going to skip to the good part.
Ooh, you need
Day
the
drinking.
for the skip to the good part, you need the skip to the end with the dude from Princess Bride.
I have that on the soundboard.
Oh, yes.
I do. Let's see. Where is it? Where is it? Where is it?
Skip the end.
There it is.
Yes.
Muted boomer. Too technical. Let's put too technical.
Yes.
When the
Oh,
host
did-
starts screaming about how technical
Did
it
you
is.
already put day drinking and my ADHD forgot that? Or
My ADHD forgot. All right, we got skip to the good part, day drinking, muted boomer, too technical, and my ADHD forgot. I think we're all caught up now. Let me save that, generate a new link. Here is the new link. I am copying it. I am putting it in the private chat for Flux to pin to the top of the chat, and everyone should generate a new bingo card. Now, of course, that means we are starting from the beginning. We have to get all of these things now going forward. We can't use what was behind us. So right now, the only square that should be checked off is free space.
all right, it is now pinned to the chat. And we are $21 away from our next shot, which, come on, people, it's starting to wear off again. So.
And we are only 10 minutes away from ending the stream. So you're under the gun here, folks.
kinds of different devices that can be used. One is the CT scan
Yes.
that has certain advantages.
Yes.
And another one is something called MRI.
Correct.
And you've written a book about that, as I recall.
Yes, thanks for mentioning it.
We'll discuss it. MRI and pediatric neuroradiology, right?
Yes.
And MRI has certain advantages too.
Yes.
To give you the complete picture. True enough?
Yes.
And in addition, after all of this, we go to autopsy if there's tragically a death.
Yes.
And findings are made there.
Yes.
And then most importantly, sections are taken for purposes of doing pathology.
Correct.
And this is where you actually take the tissues, the dura or brain or the clot, and one puts it on microscopic slides and looks to see what's there.
Yes.
That's very important findings, are they not?
Certainly.
Because we'll be talking into a second about the subdural here and the issue of whether it could be an older injury and a rebleed. But you would agree that neuropathology findings would be critical to either confirm or reject interpretations that people in neuroradiology make about this.
Certainly.
And you would come back here and you would admit, well, my interpretation was wrong if the neuroradiology didn't bear you out.
No, I would not say that.
Oh, you wouldn't?
Because sometimes we see things that they can't see or don't specifically look at, both the neurosurgeon and the neuropathologist, and that's why we
Why
have
is he leaning like that. Sir, why are you leaning into the microphone like you're late, like Judge Judy? This is a Judge Judy move. Like, what are we doing? Why are we halfway to the...
I'm gonna start talking like this and see if it helps at all. I feel like it might help.
What
I'm
is
not
he
sure.
doing?
All right, well,
Well, look how he goes into the microphone to talk. Did he do that during the direct examination?
No.
What the hell was that move? Well, you see, sir. What the hell?
In coming here and expressing your opinion, you can't withdraw. But sometimes the neuropathologists can see things that you can't.
That's correct.
All right. And when it comes to issues of the aging of subdural hematomas and the existence or non-existence of thin membranes, they're pretty good at that.
Very good at that.
Because when we're talking about aging these membranes on a continuum of time, we're literally talking about the growth of cells, yes?
Yes.
And you might be able to see suggestions of a membrane in a scan, and it might not be there. But then the neuropathologist can...
I want to point out that the cameraman has never panned over to the prosecutor. He must be so freaking boring because I don't remember the cameraman ever focusing on the prosecutor while he was asking questions. Do you?
I feel like he's maybe like looked at him once, but then always
Then
gone to
goes
the
back.
witness.
But like
Versus-
he zooms in on Barry. The camera
Yeah.
likes him.
tell you if
I
they see any
mean-
of that.
Yes.
He's a
Well,
pretty
yeah,
cool
I mean, he's
dude.
interesting with all his
Yeah.
hand motions.
And it's critically important in order to do a good and complete workup in a case
Yeah, I'm going to call distracting hand motions.
such as this. First of all, to have the clot itself that was removed. Fair enough?
Yes.
Because if you look at the clot itself and you take that to neuropathology, you analyze it, you might be able to see evidence of whether or not there's growth of fibroblasts and capillaries that could give us precise data on aging.
Sure, but one needs to look at the rest of the brain and the membranes because particularly in the traumatic brain injury of child abuse that is...
$5 more. How much closer are we?
That puts us down to 21 minus 5 is 16.
$16 away.
16.
And I do feel like the third one is going to really help me the most.
I feel like if we
is
do a
almost
third
gone.
one, if we do a third one, do we have to extend the time?
Ooh, I don't know.
I feel like if we do reach another $16 and we make a third shot, maybe we need to extend it like 15
We need
minutes.
to extend it at
or
least 15.
30.
Yeah, 15 minutes. 15
Okay.
minutes. Yep. That's enough time to know if we want another one.
Recurrent traumatic events.
But thank you
There are
so much for the
almost
$5
always
super
findings
chat.
of
Thank you,
that
ladies. You're both
elsewhere.
fantastic. Thank you.
We agree wholeheartedly. Thank you.
In the brain, not just in the area of the acute hemorrhage.
Right, so you would want to look at as many sections as you could of the brain and be very careful with it.
Particularly the lining or membranes of the brain, yes.
Right, you don't want to just be careless and throw away sections of the dura, for example, for analysis. That wouldn't be a good thing, would it?
I certainly wouldn't do that.
And you don't want to be careless in your handling or destroy parts of the cortical surface of the brain as well, because you want to be able to correlate that back up with things that you see on the CAT scans to see what the true nature of them is.
Sure.
I don't know why this one
we
didn't
can
show
only
up,
do the
but it's
best
a
we can
$10
with the
super
data that we
chat.
have.
So does that mean we're only $6
We're
away?
$6 away. Thank you so much, Mel, for the $10
Woo!
super sticker. I don't know why it didn't flag as a super chat, but it is a super. It shows on YouTube, just not on Streamlabs. But thank you so much for the next $10. That means we are 6 away.
$6
We are 6 away.
6
Hell
away.
yeah.
And since I have now fixed my Suno tab muting issue, I will share with you my favorite part of that song, and we will jam. We will have a dance party for a minute. So $6 will get us a shot and a dance party.
Have available in evaluating any of these cases.
That's correct.
Okay, now you were asked a whole series of hypotheticals at the end of your direct examination, making certain assumptions about Matthew's condition. on the morning of February 4th and the day just prior to it. True?
Yes.
And you've reviewed the medical records.
Not really.
You haven't reviewed the medical records in this case?
No, I don't want to be biased by the medical records or talking to Dr.
What?
Newberger or anyone else.
Wait.
Whoa.
Wait.
Okay, wait. I can understand this. Wait, no, I can understand this. Hold on before we jump to conclusions. I can understand why, if this is an expert, he may want to do his own investigation without looking at other people's medical records so that he isn't biased. However, in a situation like this, isn't it critical to see the records that existed? I mean, I don't really know how he could do his own investigation without looking at the existing medical records.
You can't. You have to look at prior history. My cat understands that I'm getting very distressed at this moment.
Flux is going to get angry. Flux is angry.
How? Not only that, but we received another $10, so we're doing our next shot in the next 15 minutes. Yes, thank you so much. Character on the floor laughing really hard. Hell yeah, that's what we're about to be. And then $2 from AP. Thank you so much. Told you Flux doesn't do maths good. I do maths better when I haven't been taking shots.
Another shot and also a dance party. Here's my favorite part of this song.
I just buy a seat. You feed a joke, I don't even got a tweet. Lip filler, migration, face on vacation. Still got the nerve of defamation accusations. You stalk folks' lawns, but call me obsessed. Ma'am, you filmed it yourself, exhibit A, press yes. Court filing, hobby lawsuits on repeat. Paperwork warrior, but you're losing in the street. Crying bullying while you rage for views. Then monetize drama with tell-all interviews. You don't want laughs, cool, here's the hack. Log off, go heal, don't hit post on the crack. No stream, no meme, no thread, no back. But you love the spiral, number say that.
Yes!
I love it so much. So we were $6 away. So plus the 10 makes us 4 from the next shot, which puts us 26 minus 2, which is 24. So we're technically 24 from the next shot. But this one will be to day drinking with fun friends.
To day drinking
with fun friends.
Yeah, the third one goes down like butter.
So much easier.
So much easier. Oh, Flux Pet's cat.
Yes.
Also on the bingo card. What did I say? What was the last one I called? Because I didn't have that on the bingo card. Flux Pet's cat.
There was Angry Flux.
Angry Flux.
Because you cannot. You're saying you did not consider the previous history at all?
Yeah.
Is that what he said? He didn't consider
it. He didn't want to be biased by the current medical records, but I see
it works.
I can see it both ways though. But how did he have access to all the relevant information if he never looked at the historical medical records? And we're going to hear Barry respond to this, and I'm sure it's going to be awesome.
Oh, well, but the medical records itself, in terms of the physical findings and histories, those are important.
Yes.
Those are facts.
Yes.
I mean, the history, the actual observations of the child as best you can have it, those are facts upon which you make certain critical assumptions to base your opinions.
I don't.
You don't?
No.
Well, okay.
I look at the imaging findings. I don't like to be biased.
I don't.
Bias. You're talking about medical records. Previous injuries are going to bias your opinions on current medical injuries. What the fuck are you talking about?
How did the jury sit there and come on? You got to be kidding me. This is bad. This is bad.
You're saying hypothetically, okay? Hypothetically, we're talking about hypotheticals. I'm not a doctor, but this is just my normal human person brain. Let's say I break my arm, right? It heals fully cool. If I re-break this arm, Is it going to be easier? Should the doctors know that it's been broken before? Maybe like something happened where it wouldn't have normally caused the injury, but because it was weakened from a previous injury, it then broke it. Like, what do you mean? What do you mean?
What do you mean? This is crazy. He's also still leaning down into that microphone.
Other data.
Good. Now, you would agree that it would be important to know, in looking at the overall picture in any particular case, whether or not in the hours before being presented at the hospital, the child was lethargic. True?
Yes.
Drowsy.
Certainly.
Difficult to arouse.
Yes.
Loss of appetite.
Correct.
Even inability to move the bowels over a 2-day period.
Yes.
These kinds of things are sometimes seen in evolving brain injury.
Yes.
And just on the issue of skull fractures and things like that.
Yes.
Skull fractures are fairly frequent, but immediate loss of consciousness is rare in children.
In accidental trauma, that is true.
And the fractures in such accidental trauma, or fractures, are linear.
Correct.
And often combined with suture.
Just the logistics. Mass Proposal Rule 803, subsection 18.
It's his book.
We didn't establish that yet.
It's his book.
I'm asking, I'm going to put propositions to the witness, and I have great confidence he won't disagree with
guy
them.
wrote the book.
The question, I suppose, is whether the witness concedes the authoritative nature of the treatise, and there are authors who change their minds.
Thank you.
I'm not...
Yeah, but if he changes his mind,
if at any point...
You have leave to ask the doctor if he regards the treatise you're holding with his name on it as authoritative.
Well, yes, I'm just...
Or shall we assume the answer?
You like your book.
I would rather assume than state it.
And actually, as we're talking about books, this is a book about MRI and pediatric neuroradiology. Fair enough?
That's correct.
And let me ask you if you've ever seen or read or aware of this book, Imaging Head Trauma by Dr. Lisa Jean.
Yes, I have. I've read it many times. It's an excellent text. You want me to keep it? You can bring it to me?
What?
He said he's so close to getting in the box.
Yeah, Barry in the box. Oh, did I add that?
I think you did.
Did I add Barry in the box?
It's not on my card, though.
I didn't add it. Oh my god. Right, wait.
Boo.
Throw out your bingo cards. Throw them out. We will redo the ones that we have: distracting hand gestures, free space, flux pets cat, and angry flux. But I have to put Barry in the box.
Yeah, he was so close.
He's so close. Barry in the box has to go on the card, obviously. Yep. My ADHD forgot.
My ADHD forgot.
When we come back, you can also check off that one. Barry in the box. All right, let me save that. Let me give Flux the new link. Everybody throw out your bingo cards. We're starting over.
Can you hear my kitten crying?
I cannot.
Okay, good.
All right, Flux, here is the new link. Put that on the YouTube. And everyone generate a new card. And once you do that, you may check off.
All right, it is now pinned.
Free space, objection, Flux pets cat, Flux angry.
Oh yeah.
What were the other ones?
My ADHD forgot.
My ADHD forgot. ADHD.
I don't remember.
And there were other ones too.
Oh, day drinking. We got day drinking done.
Oh, yeah, right. Day drinking. Do I?
Oh, and we got
have-
objection too. We got objection too.
I said that. I said that.
Mhm.
Oh, and distracting hand gestures.
Oh, yes.
Yes. Okay. Oh my God.
This is great.
terrible.
This is
terrible.
great.
It's horrible.
That's
Chat, this is horrible.
terrible.
This is just horrible. Okay. Yeah, the judges' flowers are always in. And we should keep track. New flowers.
Yes, I was just
next
gonna
time.
say we need to figure out how often he changes the flowers because he has one on each side.
I'm gonna add for next week a bingo square that says new flowers. So far, I feel like these are the same ones.
I mean, I don't. What day of the trial are we? And they have to be new ones from. Well, I guess it depends on what day we noticed the flowers and then how long it's been
Yeah.
since we've noticed the flowers.
You should change the ticker to how many dollars we are away from the next shot.
Ooh, that is a good idea.
Mhm. I have lots of good ideas.
Sorry. You and Dr. Jean are.
You and Dr. Jean are colleagues.
That's right.
She is the chief of neuroradiology at a prestigious hospital on the West Coast.
University of California, San Francisco.
Excellent
Yes.
place.
Yes.
Agreed? Just recently, in the last few weeks, Dr. Jean came here there was a big conference here at Harvard.
A Harvard postgraduate course on neuroradiology.
Right. And did you put that one together?
No, I
The check, can we get a little closer to the center?
Oh, I'm sorry. I'm a wanderer, Your Honor. I'm sorry about that. What was that conference?
No, I mean that. I'm the center of the matters that we're all.
Yes, yes. Well, let me
The
just.
conference in Cambridge or wherever it was, maybe.
No, my point, Doctor, without going into your interchanges and interactions, you don't hesitate in saying that Dr. Elisa Jean is a first-rate neuroradiologist and one of the leading figures in your field.
Yes, in neuroradiology, yes.
And as a matter of
Spelled G-E-A-N.
G-E-A-N. As a matter of fact, this book that you say you've read many times and rely upon, we're talking about trauma.
Correct.
Okay.
For the record, that's Imaging of Head Trauma by Dr. Elisa Jean.
Yes. Now,
Well, before we get into further book reviews or blurs, the case may be, I'm told the juror's coffee is here. So, all right.
Oh, coffee break.
Don't discuss.
They're having a coffee
Oh.
break. Isn't that on the bingo card?
I'm pretty sure, but isn't that for our coffee break?
Yeah, but they're having one in court. It counts. I'm calling
Okay, it
coffee
counts.
break.
It counts.
It counts. All right.
Damn it! No, it doesn't. I don't have it on my card, so nobody else can call it.
I'm calling it. It's on my card. Damn it.
Oh wait, I do have it. It's in the corner. Never mind. Never mind.
Everyone, as you were. All right.
As you were.
Coffee break has been called. Dr. Patrick Barnes, part 2 is what we were on. We need part 3. Where is
Did we
Barnes?
finish that video?
Yes.
Oh wow! Look at us go.
I know. And we have to be
Finishing a
here
whole
till,
video.
we promised to be here till 1:30. So far. How many
Yes.
more dollars? 24 till next shot and an extra 15 minutes. All right.
15
incidentally,
minutes.
You would agree that
15 minutes.
15 minutes.
skull fractures, a finding of a skull fracture has little.
Yeah, anything can
Prognostic
happen on Retro Thursdays.
That's
Anything.
True. Anything can happen.
And
That's what makes
I
Retro
take it what you mean
Thursdays
by that
magical.
is that a child that presents with a skull fracture may not have any injury to the brain,
That's correct.
and a child that presents without a skull fracture may not have any injury to the brain. May have injury to the brain. I'm sorry.
That's correct.
And in fact, sometimes what happens is that children present at the hospital with a skull fracture, but they're not even given a CT scan or an MRI because they seem to have no other problems. They're just monitored and sent home to wait for the skull fracture to heal.
That's correct, but there is a new trend or a recent trend over the years to do a CT scan early because if it is negative, it can save a hospitalization and the cost of it.
Right. And one of these issues, moving to subdurals, is that you were describing for the jury in your direct examination the difference between an arterial bleed and a venous bleed.
Yes.
Remember that? And the arterial bleeds from an artery into the subdural space, that's fast.
Yes.
And venous bleeds are slow.
Slower, yes.
Slower. That's because...
Ladies and gentlemen, refers to coming from the vein. This is no reference to bleeding or Roman mythology.
or the planet.
And the ethereal, I prefer to be classic.
Real quick.
Or
You know what? One of the reasons why I love Barry, and again, this has to do with my autism, is his outfit is always very mild. Plain tie, plain shirt, perfect.
So you're not distracted by.
You're not distracted.
See the guy
even a
in the
little bit.
background with the really loud tie.
It's very loud.
It's very loud. It's screaming at me from back there. It's like,
And-
look at my tie. Look at my tie.
And you want to know, like, for me personally, when I'm sitting here and I'm observing a tie like this, I'm not listening to any of the trial. In my brain, it's the only thing that's happening is, are those seagulls? Is that birds? Is that fruit? What is on that tie?
Yeah.
And I can't think about anything else.
It is nice for people who get distracted easily to just have plain clothes that like are appropriate. Like he's professional,
Just
but also
a very
it's not,
nice combo.
It's not drawing the eye.
Yeah.
Yeah.
And
I
we
agree.
did receive another $5. Come on, let's feather this. Thank you so much, Rozilla's Realm, putting us down to 19.
Yeah. You know, I'm up for another one. I still feel pretty good. My head feels much better. The heating pad and the whiskey are working. So, yeah.
The heat in my house has been wonky, so the alcohol is helping with that.
Yeah. Me and the heating pad is helping me. Don't you have a heated blanket or something?
I do. I could go get it. However, that would require me getting up. And I don't feel like doing that right now.
All right. All right. Fair enough. Fair enough.
Just me being lazy.
Fair enough.
Now, when we're talking about a subdural with a venous bleed, sometimes those little bridging veins. We've had prior testimony here about those little bridging veins on the skull, right? And those, sometimes when there's rotational injury, they tear, right?
Yes.
And then you get these slow bleeds into the subdural space.
Yes.
And if the hemorrhage is venous, coming from a vein, the accumulation in subdural hematomas may be slow.
Yes.
And they may go undetected for weeks or months.
Yes.
And then even with time, sometimes those bleeds stop and they do something called resolve, right?
Yes.
They heal and disappear.
Yes.
That can happen.
Yes.
And then on other occasions, even a trivial jar or jog can make it rebleed.
Yes.
And one of the things that, in the course of this case, you understand, one has to determine in looking at that subdural hematoma is whether or not this is an instance where there could have been an older injury present and then a rebleed which causes the acute clot you were talking about, but there's older injury pre-existing. You understand that to be the issue.
Yes, that's one of the issues.
Now, and you would agree, just so we're clear about this, that to the extent we have Dura available.
Oh, is that a new 10 or is that
It
the
is
old
a,
one?
No, that is a new 10 from Celestial Force. Thank you so much. It's good to see both of you streaming old school trials. That puts us 9 away. 9 away.
9 away. And look, you only have 7 minutes before this this stream ends. 7 minutes to get $9 in. Let's do it.
That's a good amount for a little bit amount
of time.
Yeah, that's a good amount of time.
And obviously,
you so
to
much.
fully assess that issue, it would have been very nice to have the clots so we can do some analysis of that to see whether there's evidence of membrane. That would be useful data. I think you agreed to that.
I would agree to that, but I would qualify that in child abuse with recurrent head injury,
I'm asking about this case.
that's what I'm talking about this
All
case.
right, so.
How do you know if you
yes or
have a
no?
recurring head injury when you didn't
Let
look?
us finish his answer.
Uh-oh, sticky widget.
Right.
Sticky widget.
Sticky! Sticky! Hold on, let me, wait, where did it go? There it is, with another $10 drink. Lord,
Nice.
like, I mean, when we started, I had like this much, and now I have this much, which is all right.
I'm still at the top of my bottle
Because
but it was brand new, so
this is still so much better than the vodka. Oh my
oh
God.
my god,
Just
yeah, that
two of
vodka
those
was
vodka,
gross.
it
Gross.
destroyed my life. It was horrific. But oh my goodness, hold on. We got that 10, which put us technically 29 away, then another 2, which is 27, and then another 2, which is ultimately 25. So a mill with a $2. Thank you so much. A little time. Yes, just a little time. And then wait, where did it go?
You have to reset
$4.
the ticker. You have to reset the
do.
ticker.
Wait, that
Oh
was
my
4,
gosh,
not
there's
2.
another 4. Okay, wait,
So
what?
that was 1. Hold on, that was 29.
We're losing track.
Minus
of the math.
4 is 25, plus minus 2 is 23. So we're 23. We're 23 away from the next shot and the next 15 minutes. So that does, are you good to act? So right now we're technically at 1:45. Are you good with 2 o'clock if we
Yeah.
were to reach another?
I'm fine.
What did I just say it was
I
at?
should be working, but whatever. I'm working on my music video. I'm getting stuff done.
Right? And like I said, it's for me it's just homework. And like I know the homework. I just have to do the
Are you
equations.
gonna
and the
feel like doing it after this, though?
See, I thought about that, and it's one of those things where unfortunately I'm not inebriated enough not to do it.
Okay, that's good.
Right now I'm just at the point where I'm like, oh yeah, I'm gonna have all the confidence in the world and I'll be able to knock it out no problem.
All right, but
When
like 2 more shots might really affect that. Especially because you haven't eaten anything today.
But-
All right,
but
you know what?
to be
Maybe we
fair-
should both go get snacks.
That's true. I could go get I typically keep Ritz on my desk, however they're on my coffee table right now. I'll
Oh,
go
no.
get Ritz.
Oh no, Sticky just said another 20.
Oh, that means we're $3 away. Oh wait, and another. We have 2 shots.
Okay,
we
I
have
have
2 shots and 2 o'clock.
I have to. Okay, 2 shots and 2 o'clock. I can do. I can't go past 2 though.
Okay, so right now we're at 2 o'clock and 2 shots.
Okay.
And yeah. Thank you so much because we got that one. And then we got this one. Did I already pick that? Which one did I miss? Did I miss one? No, because I got stickies. And then it was the ditto. So we are at, I have to take 2 shots. And now, unfortunately, we have run out of time. So for the next few shots, which, hold on, I need to do the math. So we were 23 away, so that's 2, so that's 27 from a next shot. However, we won't be doing time.
Right.
So it's gonna be, what did I say? So it was 20 minus 28.
Oh God, math. I can't do it. I'm glad you're doing it. I can't do it.
That's all right. We're at 28 to the next shot, and we owe 2 shots.
All
Come
right.
on.
Are you ready for the
All right.
shots? Are we ready?
So this just because I told my sister about it last week, and this is what she said to me. For prostitution!
For prostitution!
For prostitution! Because we're prostituting.
Here, here.
So here's the deal. Real simple math. No chaos crop. I ain't got a path. You stop the show. Silence, no cow. But till then,
We'll take the next one in about 10 or 15 minutes. No, she thought it was hilarious. She goes, I love that you're prostituting yourself.
I'm so proud of you. Don't slow down now, boo. I'm so proud of you.
Okay.
Oh no, we're not using shot glasses either.
Nope. No, we're
Screw
winging
shot
it.
glasses.
We're winging it, folks.
We're filling
winging
our
it.
mouth and then taking a hard swallow.
Where's my wand when I need it? Where's
Phrasing.
we're filling our mouth,
That was a good one.
taking a hard swallow.
That's what she said.
Did you see Lips's? Did you see Lips's beauty video tutorial?
Oh God, no.
Oh my God, she showed
No.
us all how to use face tape and glue. Yeah. How did you miss the show last night? Are you telling me you didn't watch the show last night?
No, I was there for like probably the first 30 or
Did you
40
go to
minutes,
Rumble?
and then
You didn't go to
I fell
Rumble.
asleep on the couch.
You
I fell
didn't go
asleep
to
on the
Rumble.
couch. No.
All right, I'm gonna need you to go to the Rumble replay and fast forward to the end and watch.
Rumble
And
is
watch Lips's makeup tutorial because she showed us all how to use super glue and medical glue and face tape to tape your face back, and also
not actual super glue though, right?
medical super glue.
Like so the thing that you like use to seal up, like
Yep.
instead of a stitch.
Wounds. Yup.
I don't know. After the karaoke, man, I just
No, you got to see it.
like
No,
I'm
you have to. No, I'm sorry.
I already deal with my own mental issues.
I'm vetoing whatever it is you're saying you can't watch. You have to.
Okay.
You have to. I'm sorry. I'm just saying.
Yes or no? Would you agree
Uh-oh. Yes
that
or
it would
no?
have been useful data to have the clot that was actually removed in order to do a
Wait, I'm gonna
pathological
answer.
analysis of it?
What?
It might have been helpful, yes.
I'm gonna answer his question.
And,
We got to answer. Wait. I gotta
it
go
would
this
be
way.
helpful to have all the dura carefully examined to see exactly what we have. That would be helpful too.
Yes, but also the arachnoid.
And the arachnoid. Okay. Now, and you say the arachnoid, doctor, because I take it from your direct examination yesterday that you said that that dark area next to the skull, in your opinion, was a mixture of CSF and liquid blood.
It could be.
That, is, in your judgment, is the most probable interpretation.
I think it's one of three things, and I think I mentioned them clearly. That is...
Is that the one that you think is the most probable interpretation?
No.
Okay. I noticed yesterday in your examination, that was the only one you mentioned yesterday, yes?
Yes, when I didn't have my glasses.
He was given a pair of glasses. Why does that matter?
You're telling me that yesterday, when you looked, let's just be clear about what this was.
Oh my God, he's not about to say that he missed. No.
What is happening with the demonstratives? Barry, come on.
Did he just say that he missed something because he didn't have his glasses on yesterday? Is that what I just heard?
I don't know, maybe. They were making cracks about the glasses. They said that Barry sabotaged them, remember?
He just used it as an excuse right now. But it's like, how do you use that excuse when you were given a pair?
You were talking to the jury about this dark area.
So can we just reference the exhibit and what frame that is from the exhibit?
I'm sorry, thank you. The exhibit 27, and this would be the preoperative CAT scan of February 4th, image number 5. And you pointed to the dark area here, okay, that is in between the whiter area, and you said yesterday only that that was a mixture of CSF and liquid blood. You recall that?
Yes, I do.
Now, you're not telling me, or are you telling us, are you telling this jury,
Wait, why are the captions not working? What? Wait, hold on. Where? The captions are gone. Okay, I guess they can't understand what they're saying right now. Sorry.
I was so
That makes all of
distracted
us.
they were trying to get my glasses. Plus, I was
Get
trying
in
to
the
work
microphone,
inside.
Barry.
Because I didn't get to explain.
Glasses is an excuse to why he testified to something yesterday.
Was that, that was a joke.
Well, yes, I was distracted yesterday not having my glasses. That's what I meant, not because I couldn't see it.
Now, just so we're clear.
Take another shot. We gotta finish that second shot.
Oh shit. All right.
And the fact that he's using the fact that he didn't have his glasses yesterday as some type of an excuse.
Yeah, that's pretty hilarious. But also, as a almost 50-year-old woman, it is an excuse. I'm sorry, but the reading glasses are
Well, see,
absolutely key.
would you
If you don't have them and you try to read something, you could absolutely read them wrong. I'm just
but
coming
you were
at
given another pair.
well
Like,
that
let's say somebody
no, that was today. Well, no, you're right. That wasn't
Barry
yesterday.
gave him a pair. So the fact that he didn't have his glasses literally means nothing because
Nothing.
he
Okay,
got a pair
I
of
can also
glasses.
attest that anybody's glasses will do. They're all the same. Reading glasses are
When it comes
all
to
the
like,
same.
yeah, reading
These are
glasses.
these are reading glasses. They have like a -2 magnification, but even if they were like a 150 or a 175, I could still read it better than I can without them.
But
I
like
will
that's what
say,
he's saying.
I will. Have you got to the point yet where you need bifocals?
No, no, not
How old
yet.
are you?
Oh,
How old are you?
I'm 34.
Oh yeah, you've got time. You've got time.
Well,
When
but see,
you hit 40, trust me on this. When you hit 40, I want you to on your 40th birthday, I want you to walk into a Walgreens, take your phone with you, go to the eyeglasses, reading glasses section, put on a -1.25 frame, and then look at your phone. And if it looks amazing, buy them and walk out the door.
see, I know I'm gonna have problems because my dad, he was legally blind. He wasn't like actually, but he was legally blind. So
Yeah.
like you took off his glasses, he couldn't see 2 feet in front of his face. And I feel like that's where I'm gonna be at. So I think I'm just gonna go skip over the whole needing reading glasses altogether and just need, you know, the X-ray vision.
Well, no, so here's the do you ever wear contacts?
I did when I was younger, but not in
You're
years.
gonna want to go back to them. And here's why. When you hit 40, 45, you're gonna need reading glasses. And so you're either gonna have to go with bifocals or you get contacts and then you just wear reading glasses when you need them. And
I
trust
just
me
get a
when I tell
magnifying
you,
glass?
contacts is so much easier than
Oh.
bifocals or progressives. I have progressives,
See,
but they suck. They suck.
One of my buddies, he just got LASIK done like a couple weeks ago. And he's like, bro, you should do it. You
I
should
know
do it.
everyone says that, but then I watched the surgery online.
I'm so
And I'm
scared.
like, fuck that. They peel your cornea back and like, nuh-uh, no.
It's like one of those things where even the slightest possibility of something going wrong is
And you're
so
blind.
low. But exactly, that so low probability is devastating.
These are my
devastating.
eyes. These are my eyes. I like don't want it. And also you can wait too long and then the surgery is pointless. So I'm probably
Really?
at that point now where
Oh,
forget
I
it.
didn't know
But
that.
I'm okay with it. I can wear contacts and wear my reading glasses and I'm fine. And if I'm wearing glasses and no contacts, if I take my glasses off, I can read fine up close because I'm very nearsighted.
See, I have one eye that's nearsighted and one eye that's farsighted.
Oh, that's bizarre.
It's weird. And then astigmatism on top of it. So like
Jesus.
I can pretty like if I focus, I can read the chat with my right eye. But with my left eye, absolutely nothing.
we're supposed to be doing a shot right now. We're not doing
Oh, that's
that.
right. That's right.
What?
You have horrible eyesight.
Let's go. Let's go. Let's fucking go.
Oh, that fourth shot is so good.
Lip filler, migration face on vacation. Still got the nerve of defamation accusations. You stalk folks' lawns, but call me obsessed. Ma'am, you filmed it yourself. Exhibit A, press yes. Court filing hobby lawsuits on repeat. Paperwork warrior, but you're losing in the street. Crying bullying while you rage for views. Demonetized drama with tell all in the.
God, this song is good, right? It's good.
It's love good. The beat. The beat is just so like dun, 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 dun.
I know. Well, here's what I did, and it took a lot of tweaking. But here's TWEAKING. If you know what movie that's from, say
what?
in the chat. TWEAKING. Tweaking. If you know what movie that's from, put it in the chat. I know some of you do. There's someone out there who knows. Anyway, it took some tweaking, but I got it, and it was disco beat.
Really? That's considered
with a disco beat. Yep. TWEAKING. No one's got it yet. Oh my God.
I have no idea what you're talking about.
There's someone in this chat who loves this movie as much as I do, and you will know it. My daughter would know it immediately because she knows every line to this movie, and she will watch it and say it.
Can I get a hint?
Yeah, I will put it in the private chat. I wonder if you've seen it.
Well, what year is it from?
Oh God, 2000 maybe?
Oh, see,
check the private chat.
Oh, I never saw that movie.
What?
I grew up in the straightest of edge Christian houses.
Ephron. It's Nora Ephron. You must.
If it wasn't a Christian movie, I didn't watch it.
Listen. It's as important to American cinema as oh God, what's that movie? Sleepless in Seattle. You have to see this.
I've never seen that one either.
How do you not know? The chat doesn't seem to know either.
Is it a chick flick?
Yes.
Oh, see, that's probably why.
Nora Ephron. She does all the chick flicks. But you said you didn't see it.
No, I didn't watch a lot of chick flicks. I was a nerd.
God.
I still am a nerd.
Mary Jane, how do you hate Tom Hanks? Who the hell hates Tom Hanks?
Okay, and to be fair, Tom Hanks
is in it.
He fled to Greece, kind of, allegedly.
Well, who cares? You know what? I don't care what these people's political views are. If they make good entertainment that I like, it's fine. What do you mean, who the hell is Nora Ephron?
See, I don't know that name either. Hold on.
Yes, you do, because she made Sleepless in Seattle. And
I never saw Sleepless in Seattle.
No.
Megan, when it comes to like chick flicks and culture, no, it's got to be like nerd movies.
Wait, are you the butch?
No, I'm not even the butch.
Well, then why aren't you watching chick flicks? Yo, Gemma got it. Yeah, it's You've Got Mail. I've got a situation that needs tweaking. Tweaking? TWEAKING. Tweaking.
No, see, if it was PG-13
when Harry met Sally,
I've never seen it.
Oh, okay, guys. Flux. I'm sorry. Where's Mrs. Flux? Is she home?
No, she's not home from work yet.
You need to quiz her when she gets home if she's seen these movies while you were sleeping. No, not that.
I was going to say, that one I love While You Were Sleeping. That's a good one.
That's actually very similar to these, but it's not the same. It's not Nora Ephron. Sorry. I don't know why I said that. Probably because it's one of my favorite movies. Sleepless in Seattle. You've Got Mail. When Harry Met Sally. Yeah, which ones has she seen any of those? I realize you're younger than me, by a lot. So they were
But
not
see,
in your genre, really. They weren't in your generation.
I
But
think that was the year, like the few years where I was out of chick flicks, but before I was into chick flicks again, because like so many movies, I did watch chick flicks, but they were like chick flicks after, I don't know, like 2004,
oh, you've
2005.
missed all the good ones. All
See,
the good ones.
I watched Ever After. That
Oh
I feel was a
God.
chick flick.
Oh
That's a chick flick.
yeah, but you've missed the good ones. I'm sorry, but you have. Oh, hold on. Where's Grok? I need
Name
Grok
another
right
chick
now.
flick. I've probably not seen it. Well, no, I've
Hold
seen
on. I need Grok. Wait. Name
like all of the
all
Lord of the
Nora
Rings,
Ephron movies.
Bill and Ted.
Well, Nora Ephron is probably the greatest chick flick maker that there is. Sleepless in Seattle, You've Got Mail. I haven't even. Oh, Julie and Julia, which was very, very good.
Oh, I saw that one. That's the one where Amy Adams and
Yes.
yes, I
Yes.
liked that one. That was a good one.
Great movie. So
Yeah.
I've never seen This Is My Life that she did. I didn't see that. I also didn't see Mixed Nuts. So maybe I'm the one who hasn't watched all of these. So apparently the only ones that she's done that I know are You've Got Mail, Julie and Julia, and Sleepless in Seattle. But my God, You've Got Mail, Flux. It's not only a great chick flick, but it's a time capsule.
Oh, see,
For those of
yeah.
us who were in the AOL online community when it first started in the 90s, right? You've Got Mail.
That's
That's
signing into the chat.
Yes,
Oh!
with the ping,
The AOL and the
ping,
ding ding. Yes, and making sure that you logged in when your friends were logged in. Otherwise, you couldn't talk to them.
And the chat rooms. Remember the AOL chat rooms?
Yes.
Yes. Flux, you have to see this movie like right now tonight. You've Got Mail.
Let me write it down. You've Got Mail.
I'm telling you, it is a time capsule of life in the 90s. You have to see it with the AOL. You've Got Mail. Yes. Thank you, chat.
And Sleepless in Seattle,
It is brilliant. It is brilliant. Sleepless in Seattle is like, I don't even think it's as good as You've Got Mail, but it's still really good. Really good.
See, so my era of chick flicks was like The Notebook and The Last Song.
I haven't even seen that. I haven't seen The Notebook.
A Walk to Remember and that bullshit.
I've seen that. I like A Walk
that
to
one's
Remember.
fucked up.
That's fucked up.
That is so fucked up.
Though. It's good. It's good. I liked it. I like that girl. I like the girl that's in it.
Mandy
Hilary
Moore?
Duff.
No, that's Mandy Moore.
Mandy Moore. I get those two confused.
Mandy Moore and Hilary Duff, they are two Disney kids that, Mandy Moore wasn't super Disney, but those two kind of got out. And I don't know if you followed Hilary Duff at all, but she was able to like have a normal life.
She had a normal life. Yeah.
And she still has a bit of her celebrity, but like, good for Hilary Duff, man.
Agreed.
Except for that one commercial she came out with where she yelled at people for calling shit gay, and I'm like, that's gay.
Well, look, what's her name? I've derailed. Oh shit, the whiskey is catching up.
See, this is what I love about Retro Trial Thursdays is we start with the trial, but it's really just an excuse to kind of have a break and hang out.
We're just gonna hang out. Like, that's what we're doing. Yeah. Oh my God, how have you not seen You've Got Mail? I can't even believe this.
See,
all right,
was it PG-13?
No, probably
we could do a watch party.
It was,
but not.
I would like to, but how do we do that?
Like on Locals, how you did with Brad, but not that terrible movie. That was a horrible movie. I hated that movie so much.
Did you not see that before we did it?
I had never seen the movie, and then I sat there and watched with you guys the whole time.
The ending sucked, but it is a great movie. It is. Come on. It is.
I mean,
it's a great love story.
All I remember was being angry that it ended the way that it ended. I was like,
right.
come on,
All right,
guys.
we have to call Brad and we have to get him to somehow pirate or download You've Got Mail so that we can watch it together on Locals because we're
Is
gonna.
that how we did it?
Yeah, that's how we did. Brad,
I'm
I'm
I
texting him right now.
yes, because
Brad.
like I don't down. So the creator of Minecraft, he came out and actually said, if we don't actually sell these copies of game where it's a digital license and you can take it away at any time, they actually don't own it. So is piracy really pirating something because they're not going to own it anyways? So
Ooh.
essentially, it's not pirating anymore because we don't own anything. It doesn't matter if you pay for it; they can take the license away at any time.
I just texted Brad. BRAAAAAD, which is how I always text him, Brad. And he responded, Megan, can you download You've Got Mail? Okay, I'm broadcasting that he's going to commit a crime. No, he isn't. He's going to tell me no. He's going to say, no, I can't do that.
And not only that, it's technically not pirating since when you buy the license, you don't own it anyways.
I own the movie, and I can assure you that if we watched, the movie together, we would transform it into something totally different. So much different. And no one would want to watch it like we do it. Like they would go buy the movie.
A 2-hour film would turn into a 62-part stream. And it's perfect.
I'm going to tell him I need your pirating skills.
What was that movie called again?
You've Got Mail.
No. The terrible one. The terrible time traveling one.
The one on Mackinac Island. A Moment in Time? No,
I don't think that's A Moment in Time.
What the hell is it called? I don't remember. Hold on. We'll have to ask Ross.
All I know was I was sitting here doing my math equations, listening to you guys in the movie, and then it ended, and I was like, you gotta be fucking shitting me. You gotta be fucking shitting. I've been listening to this.
It's a bad ending. What's the famous movie with Christopher Reeve on Mackinac Island?
No, I don't think it's A Wrinkle in Time. Somewhere in Time?
Somewhere in Time. That's it. Somewhere in Time. 1980.
Terrible. Because, again, technically he created a time loop. If he created a time loop, he would be forever stuck in that, meaning at some point he would be able to take that penny out of his pocket because he would remember from a previous loop that penny is what pulled him out. And this is
don't try to understand it.
I love time travel. I am so into time travel.
Time traveling is so difficult to understand. You just have to accept the premise of the movie you're watching and understand that the penny in the pocket will ruin everything.
But see, and that's the paradoxical part of time travel is because when he gets out, he would remember that if he tried to do it again, which he did, to pull it out of his pocket. But because that was before it actually happened, he would never remember that. But the time loop paradox is crazy.
Brad can get it. Brad can get it.
So maybe
okay, we are gonna do a members only on Locals, meganfox.locals.com. That's the only place we can do it, folks. I'm not trying to get memberships. I'm just telling you, it's the only place we can do it and not get shut down. Okay. meganfox.locals.com. Flux will be there. Brad will be there. We will do You've Got Mail together. So please go and subscribe. I might be able to do a free one. I'll have to look into it, but it's only $5 a month. Okay. It's not a big, and also if you only want to do it for that stream, you can cancel. Okay. I don't even care. I don't even care. It'll cost you $5. And then the next month you just cancel that shit. Okay. meganfox.locals.com. But behind the paywall helps us to stay away from the copyright bullshit. Trust me.
Mm-hmm. Yeah.
Will you both be drunk? Yes.
I feel like that's definitely going to help the chick flick.
Yes. We will. Absolutely. We will, including Brad.
Yes.
I'm
Brad
telling him,
has to be.
Get it, get it, get it, get it. That's what I'm saying to Brad. Get it.
Get it, get it, get it, get it.
Get it, girl.
Get it, girl.
Get it, girl.
Oh, what is Flux going on? Wait. What the flux is going on here? Brad, you're going to day drink with us and watch Sleepless in Seattle. That's what's going on here.
No, not Sleepless. You've got mail.
You've got mail. Sorry. Well,
not Sleepless. That one's not as good. Oh, wait. I have to make sure Brad knows the right one. Damn it.
Whichever one she told you, it's Sleepless in Seattle. Wait, no.
I told him
you've got mail.
I've told him that.
That's the one.
What is going on here? He's so funny. I just told him we're day drinking. We're on Flux's channel.
I have been working so hard with school. Literally, I wake up, I make Mrs. Flux her lunch, send her off to work, and then I sit down in front of my computer and I do school. And she comes home and I make her a snack. And she plays on her games or does whatever while I continue to do school until about 8 p.m. I need this. This is my break.
Does she know how much I love her, by the way, Mrs. Flux? Because I do. I
think so.
I love how good she is to you. She's always like bringing you lunch and like doing good things. I love her. She's the best.
I'll tell her that.
I'm a good mother-in-law. I will be like, yes, I love you. I adore you. And I think everything you do is great. That's me.
I'll make sure to tell her. Because, in all honesty, and I'm not trying to be like super sappy or overly sentimental, but she goes to work and she works overtime so that I don't have to work, so I can just focus on school.
Oh, that's so great.
She has,
and the investment will pay off, by the way.
Exactly. She always says, "You're going to be a lawyer. You're going to be my sugar mama."
Yes, you're going to be the sugar mama, and you're going to be able to tell us all about the content. Like seriously,
oh my goodness. Like it's going to be so good.
It's going to be so. And you must tell me, like, once you get out there, I have connections where you are to get you jobs. Yeah, my sister's a lawyer in Maryland. She knows all the judges.
I was gonna say, isn't she a legal and like a lawyer in Annapolis?
Yes, she is.
And I'm over here.
And she was a clerk, a big time clerk for big time judges in Annapolis. So yeah.
I got the ins, man. I'm already halfway there.
You're halfway there.
and right now, I've thought about getting a paralegal job just to kind of like, have income. But again, Mrs. Flux is like, no, I can just pick up a few hours of overtime and that'll supplement any like part-time job that I get, which is technically true because part-time sucks, and her being, full-time with the county. So I'm like, there's really no, like, I don't need a paralegal job, but, I kind of want to for the experience. But at the same time, I don't even.
If you want that, let me know, because I have some place for you to go.
Ooh, I might want that because I'm not going to lie. I just watched.
They need help. My sister needs help. Like she's got, oh my God, she has the best case right now. Oh my God. Did you hear about the horses on death row case?
Yeah. Something about how they're going to like, it's essentially another ostrich situation, but here in the States.
Yes.
Am I going to have to put horses in my Twitter avatar?
Anne Arundel County.
Yes. Okay. But did you know Anne Arundel County has been in the news for their horse issues? but also because they just passed a new law that said if you don't clear the sidewalk in front of your house, you will be fined within 24 hours.
Of snow?
Yeah. The public sidewalk.
Fuck?
Yeah. If you don't clear the public sidewalk.
Wait. To be fair, I lived in the city of Chicago for many years. We did always clear the sidewalk in front of our house. And
But can you get fined?
You
If you get
probably
fined.
shouldn't, but also if you're being a good neighbor, if everyone just cleared the sidewalk just in front of their house from their one end of the house to the other, then all the
Within
sidewalks
24 hours.
Well, the 24 hours might be a bit much, but still, it does help for commuters to walk on the sidewalk and not the street. Because I've been in the position where I have to walk to the bus or whatever, and you have to go on the street, which is dangerous. So it's better to everyone just clear that small section.
I would agree. I would agree with that, but for the fact that when the snow plows come through, they just push all the snow back onto the sidewalk.
No, not on the sidewalk. They push the snow onto the, what do you call it? There's like a grass thing before the sidewalk. It's like a well,
I guess it depends on how much snow you get.
I mean, I do understand, like, the chances of the plow hitting the sidewalk are pretty low. Because there's always
no. I mean, just the snow being pushed and piled so far over. That's what I mean.
I am opposed to 24 hours, but I do think, easement. Thank you, AP. There's an easement before the sidewalk. But I am opposed to 24 hours, but I think 48 would be appropriate.
See, while I agree, maybe, you have to let me be able to call police then for people being on the sidewalk in front of my house. If somebody's standing on the front, like on the sidewalk, and like, let's say they're screaming.
Wait, why?
You cannot call police and be like, get this person off my sidewalk.
What?
Like, hypothetically.
Oh, okay.
That's what I'm saying.
That's a good point.
That's what I'm saying. I'm not responsible.
Not technically your sidewalk. Then you're not responsible.
Exactly.
Oh, I agree.
So it's either a public space or it's not a public. If it's a public space, then public dollars need to pay to clear it.
Agreed. You've convinced me. Look at this.
This is why I'm going to be a lawyer. Because I cannot
take down that $28 till next shot. No one's doing another shot. We've had enough. You have to do your math.
Oh, that's
you
right.
have to do your math. We're not even doing trial anymore. What are we doing?
We passed 2:00.
It's time to go. It's time to go. It's time to end this shit show.
Yes. Yes. I mean, for as much as we need to go. This is my drunk speak and my ADHD dyslexia speak.
It was fun though. Thanks, chat.
Yes. Always. It's always fun, and we're always going to be back. Well, we always plan to be back on Thursdays.
Oh, wait. I'm going to put down that timestamp right now.
Ooh,
okay.
Yes, good job from memory.
We have Barry. No, not Barry. Yeah, Barry Cross. For who's this doctor?
Dr.
Barnes.
No, BAHNDS.
Whatever. Part 2, 7:33. 7 minutes, 33 seconds. We were in the second video. Part 2. Okay.
Nice.
I've got it now. Remember next week, I wrote it down in my notes on the iPad. Okay. All right. Wait, yes. Brad just sent me a text. What did Brad say? Let's see. Brad, what do you say? Oh, he said, got it. He got it. He got it. You and I will talk about when we will do this, but we're doing a members only. You've got mail on locals only, because that's the only place I can do it without getting hit.
Because so like even with like, let's say royalty-free movies. You can't even do that anymore?
I don't know about royalty free, but I'm having so many problems even with like YouTube members only. Like I can't do anything. So
That's
it's really
bullshit.
annoying. Locals.com. I will tell you what, folks, we will do a locals.com. Seriously, just pay the $5 for 1 month. We will do it and then you can cancel. I don't care. But that way we're protected, basically.
And
we
we're
will do it
watching
members only.
We're watching a movie I've never seen. From a movie when I was in high school. Wait, when did it happen? 2000?
Somewhere around 2000. Wait, let me see. Let me ask Grok. Grok, where's my Grok? Grok. When You've Got Mail, 1998.
Oh yeah. I was 7.
19. Oh yeah, so you wouldn't have seen it. You were too little.
I was 7 years old.
I'm telling you, you're gonna love it. You're gonna fucking love it. It's gonna be great. It's gonna be so good. Is this another shot on the way out?
We were technically 28 away, so I would need another 8 to get to that last shot.
Ah, fantastic.
But thank you so much for the $20. Been watching the trial with EDB. She's been so annoyed over certain things. I suggest she start doing shots every time she was annoyed. It improved another stream I was watching.
Which trial? Which trial?
She's watching the it's the it starts with a B. I can't remember.
So it's like a newer one.
It's a new trial because I do like watching EDB. I love EDB. She's hilarious. She grew up in she's from LA and like my area, so a lot of her references are like.
Share the screen I just shared with you. This is what Brock just did. I love it.
Oh my god!
Look at the truck in the background.
Yes!
It's so good!
That is awesome!
It looks like a Macy's Day Parade. I love it.
We have another shot.
Do we? Oh, we have another shot. All right, we have a shot to
send us out today.
Send us out. All right, wait, we need the music. Where'd the music go?
We need the music, but real quick, shot! And did I actually read the other Yes, I did read the super chat. So thank you so much. Yes, this is going to be our final shot of the day.
Final shot, and we're ending the stream.
Yes, we will end, but we do need the music to take the shot. And what is this shot for?
For locals only.
Locals only!
Lip filler, migration, face on vacation. Still got the nerve of defamation accusations. You stalk folks' lawns, but call me up. Ma'am, you filmed it.
Yeah, fill up your mouth and swallow hard.
Paperwork warrior, but you're losing in the street. Crying bullying while you rage for views. Then monetize drama with tell-all interviews. You don't want laughs, cool, here's the hack. Log off, go heal, don't hit post on the crack. No stream, no meme, no thread to unpack. But you love the spiral, numbers say that. The more you act up, the more you get sown. Strapped to my plow in the field you grown. Every meltdown moment, Kerching, that's we. You plant the circus, I just thresh the beat. Free country, say what I please. You uploaded the clownery, don't sue me. You light the match, then scream at the flame. I just watch the smoke spell out your name. Yeah. Top down, this live what I please. You up on in the pillory.
Oh, I could totally dance to this for a long time.
Scream at the flame.
My kids love it.
Ghosted, ego on tour. Blame the audience, never the lure. If attention's a drug, you double the dose. Then shock Pikachu when the laughter post. So here's the deal, real simple math. No chaos crop, I ain't got a path. You stop the show, silence no cow. But till then, welcome to the plow.
This was actually a dance known around my church in high school called the Flux, except it wasn't Flux, it was my real name, my government name.
So proud of you. Don't slow down now, boo. I'm so proud of you. Don't slow down now, boo. I'm so proud of you.
Goodbye, everybody.